Yes.
Is it okay, sir?
Yes.
Yeah.
Now it's
Yeah. So, friends, today's our topic is Herbomineral, Drugs and Kidney, a symposium, which will be addressed by four of the eminent speakers: Dr. Katoch, DC, who is the advisor, Ministry of Ayush; Dr. Alan Almeida, sir, who is the head of the department, Hinduja Hospital; and Dr. Umesh Khanna, Director, Kidney, Associate Consultants, Nephrologist; and Dr. Shashi Kumar, who is a practitioner and an industrialist, uh, also having his own nursing home, that is Nechil Ayurved Vaidyasala and Nursing Home, Palakkad, Kerala, and myself. These five people will be there to address this issue. So, friends, first of all, as all of us are aware that hita hitam sukham dukham ayustasya hita hitam मानव चकच्च यत्र उक्तम आयुर्वेद सौच्यते। आयुर्वेद की परिभाषा यही कहती है कि जिस ग्रंथ में हित आयु, अहित आयु, सुख आयु, दुख आयु, इन चार प्रकार की आयु के लिए हित अहित, इस आयु का मान और वायु का स्वरूप बताया गया हो, आयु का सॉरी, उसे आयुर्वेद का शास्त्र कहा जाता है। मतलब वॉट एवर वी डू एंड वॉट एवर वी speak and whatever we practice should be useful to the mankind. It should be helpful in curing the disease. That is the basic motive of Ayurveda science, and similarly, I'm sure that it is in the allopathic science also. Uh, just a second. The second thing, what Acharya Charak, these are the quotation from the Acharya Charak, the first chapter, Dirgha Jivitiya Adhyayam, means any medical science, let it be allopathic or Ayurvedic, its ultimate goal is to enhance the lifespan of the mankind, and that too with no, as we have, it has been said that swasthya shastra, prasann atma indriya और मन, इन सबके संयोग के साथ में लाइफस्टाइल अच्छी होनी चाहिए और एनहेंस्ड होनी चाहिए. That is the basic goal of all the science. So for that, in Digjivitiya Adhyay, first chapter, what Charak says that yatha visham yatha sastram yatha agnihi sannihi yatha तथा औषधम विज्ञातम अमृतम यथा. अविज्ञात तथा विज्ञात औषधि के प्रयोग के परिणाम, न जानी हुई औषधि उसी प्रकार प्राणघातिक होती है जिस प्रकार विष शस्त्र अग्नि या इंद्र का वज्र प्राण को हर लेते हैं. इसी विपरीत जानी हुई औषधि अमृत के समान प्राण रक्षक होती है. When you know the drug, it can be either, if you know the drug, it can be life saving, and if you do not know the drug, it can be fatal. Further, what he says that औषधम यन्नम अभिज्ञातम नाम रूप गुणे ही स्त्री भी विज्ञातम चा अपि दुर्युक्तम अनर्थ अय उपपद्यते. मीन्स जिस औषध का नाम, स्वरूप तथा गुण तीनों ज्ञात न हो अथवा ज्ञात होने पर भी उसका प्रयोग असम्यक हो तो वे दोनों अनर्थकारी है. मीन्स इफ वी डू नॉट नो द नेम, features and its virtues and gunas, if we do not know and if we use it, then it can be problematic. Further, one more slogan what Charak says is that yogadapi visham tiksham uttamam bhaisajam bhavet bhaisajam cha api duryuktam tiksham sampadyate visham tasmat visaja yuktam yukti bahyena bhaisajam dhimata kinchit adeyam jivitam आरोग्य कांक्षिणम. तेज विष भी योग प्रकार से प्रयोग करने पर श्रेष्ठ औषधि बन जाती है, और श्रेष्ठ औषधि असम्यक प्रयोग होने पर तीक्ष्ण विष बन सकती है. इसलिए जीवन और आरोग्य के इच्छुक बुद्धिमान व्यक्तियों के लिए यह उचित है कि युक्ति बाह्य वैद्य से कोई भी औषध न ले. Here what the Shastrakars are planning to say, are saying that a toxic part, I mean toxic drug can also be a amrut if it is used properly. And if a amrut or a good drug is not, if not used, can be a toxin and can create lots of problems. No? So friends, this is what the basic philosophy of, I suppose, all the medical science, Ayurveda, homeopath, allopathy, whatever science it is. The basic aim and goal is to treat the diseased and make them cure and try to enhance the lifespan of the people. Friends, let me tell you that during the entire course, what we have observed that wherever the kidney diseases were described, like acute kidney disease or a chronic kidney disease, it's a it's a privilege that all the nephrologists have refrained to speak about any bad words or any blaming words about the any other science. So this is how the entire course has gone. But that doesn't mean that Ayurvedic drugs cannot cause the problem. So whatever will be shown over here, I suppose we should be take it in a right perspective, in a right manner, that let us uh, understand that what problems the other science is facing and what they are observing. And as all of we are aware that Charak Vimanstan is saying Sambhasa of two types, Tadvidya Sambhasa and Vigruya Sambhasa. Tadvidya Sambhasa is an interaction in a cordial manner, and Vigruya Sambhasa means interaction with anger. Whatever we are going to do over here is a Tadvidya Sambhasa. And with this Tadvidya Sambhasa, we are going to have some ultimate output which can help the mankind and to the medical profession. So, with this one small quote that यत्र सितः कर्म गुणः कारणम समवायी यत् तद्द्रव्यम, जिसमें कर्म और गुण आश्रित रहते हैं, जो कर्म और गुण का समवायी कारण है, उसे द्रव्य कहते हैं. That is the drug. And let us understand that what are the pros and cons of the drug, and what the nephrologist sees from their practice, their knowledge in their day-to-day practice. So with these few words, I will hand over it to my reverend colleague, friend and brother, elder brother, Dr. Umesh Khanna sir. Thank you.
Thank you, Nilesh, for setting the stage. I think you'll have to stop your screen sharing and then yeah. I will. For setting the stage for this, not a very common sangam between the allopathic and the Ayurvedic on one common platform. And so we are fortunate that we had this. Yeah, we'll have to go to. Yes, we were fortunate that we had the opportunity to share the stage with stalwarts from Ayurveda and with my senior Dr. Alan Almeida, who has taught me a good bit of nephrology during my student days also. So what I thought I will cover up is that although a lot of noise is made about allopathic drugs and Ayurvedic drugs, today we know for sure that there are so many environmental toxins and their effect on the kidney that I will run through some of them, cover up the allopathic part, and then leave the herbominerals for my friend philosopher and guide, Dr. Alan Almeida, to cover up. So first, my disclosures, and this was important because of the stage in which we have set and because of the presence of stalwarts from both the pathies. So both me and Dr. Alan Almeida are familiar with allopathic drugs. We are familiar with their uses, misuse, their effects, their side effects. We have burnt our fingers using the so-called safe allopathic drugs. Oh, everybody comes and says that these are extremely safe. But in spite of tons of scientific literature, we have seen post-marketing surveys of safe drugs showing unreported adverse drug reactions and are continually learning still about how to use them. So the so-called safe drugs in allopathy have also had their share of post-marketing survey issues. The classical example is thalidomide. It was always passed, and then we saw what havoc it created. We must also confess, both me and Alan, that we have very poor knowledge but great respect for the ancient science of Ayurveda and would like to learn from the experts gathered here today about it. That precisely is the purpose of this symposium. Now, when we show some slides, case reports, or scientific papers from our allopathic literature on herbomineral or heavy metal nephrotoxicity, the intention is to learn from your experience, get your views on the frequency and the extent you see in your practice. Are these rare? What is your data? Because what comes in it, as Katoch during our initial Katoch ji se jo baat initially हुई थी, उन्होंने straight away कहा था, the red bulbs हमको दिखते हैं, the green bulbs are the ones where you see so frequently, and you manage patients with Ayurvedic drugs, and so you see the advantages of them. But before we go to the drugs, let me tell you that the plants have provided remedies for the ailing since times immemorial. Important drugs of botanical origin have been digitalis, quinine, salicylates, taxol, this anti-malignancy drugs, paclitaxel, etc., which are so commonly used for so many malignancies. Hamari allopathy mein, they are all botanical drugs. And more recently, the wonder drug for malaria called artemisinin, again, plant-based. Currently, around 120 distinct chemical substances derived from plants are being used as drugs. So, Sangam dekh rahe ho aap, plants and use in allopathic drugs. We have a very robust science of Ayurveda and modern Ayurvedic drug manufacturing companies who follow the GMP norms, and our traditional science of Ayurveda is flourishing with the Ayush Ministry and regulatory bodies. Jisme se I think there are few in which through whom Nilesh always communicates. They are doing a fantastic job. However, herbal medicines dispensed in a crude way by traditional healers, they form the mainstay of treatment for many poor, ignorant, and rural folks, which is true not only in India, but many other countries. So we were taught in medical school about allergy, that everything under the sun, including the sun, can be an allergen. And today we are learning that everything under the sun, including the sun, could be an environmental toxin and can cause toxicity. For example, just the mere temperatures or heat nephropathy, we are learning about it. Food supplements, chemicals, heavy metals, herbominerals, and of course, drugs, jo aaj ka topic hai. But more than the drugs, there is a huge number of environmental toxins which you should be familiar with. So today's symposium is all about knowing these toxins, avoiding the toxicity, how to use these drugs, proper knowledge of its use and misuse. There is a growing concern about environmental nephrotoxicity, climate change, environment, aajkal ke buzzwords hain. And that's because a high level of exposure to many of the environment toxins can increase the risk of acute kidney injury, tubular function, dysfunctions, Fanconi's, and so on. So there is increasing recognition that not only acute disease, but chronic exposure to these small lower levels of environmental nephrotoxins may contribute to CKD. And all nephrologists are flummoxed by the fact they don't understand this new disease entity called CKDU, CKD of unknown origin, a new entity which it's not now very new, but in the last few years, and it's likely to be caused by environmental toxins. So kidney has actually become a victim of its own brilliance. And why do we say this brilliant organ? It receives 20% of the cardiac output, and hence the exposure to toxins is very common. So what are these brilliant functions of the kidneys? Most important is maintenance of fluid, electrolyte, acid-base balance, and maintenance of what we describe as milieu interior. Then the hormonal functions of regulations of blood pressure through renin, salt and volume, the erythropoietin, the prostaglandins, the vitamin D, and so on. But for today's talk, what is important is that the kidneys do the brilliant job of excretion of waste products, toxins, metabolites, chemicals, and drugs, and making kidneys susceptible to the kidney disease, which is why the topic is of nephrotoxicants, because of the kidney being the victim of its own brilliance. It has a very peculiar physiology of filtration of plasma, reabsorption of the essential products, the countercurrent mechanism of the loop of Henle, the specific role played by the proximal convoluted tubule, distal convoluted tubule, and collecting tubule. All these things, we try and maintain the electrolyte balance, and they try and manage the chemical and toxin elimination. And which is why, as mentioned, and you will see in the next couple of talks also, that the tubules are vulnerable to the tubular injury. And aap dekh rahe ho in this segment that at the level of Bowman's capsule, these are the chemicals which cause problem. Distal tubule, these cause problem. Collecting tubule में lithium, you will see lithium toxicity causes disease here. Platinum, cisplatinum, lead, cadmium, mercury, arsenic, all this here. So basically at different levels in the kidneys, various chemicals and toxins work. I'm yet to reach the drug level. We are still discussing food, fruits, vegetables, superfoods, vitamins, alternative medicines. So the ancient system of medicine has been practiced in India by expert practitioners, or Vaidyas as they were called, from times immemorial. Apart from India, you see a lot of these medicines practiced in China, Africa, Native Americans. In fact, the natives of many advanced countries also used to practice indigenous. They call it under one label called CAM, or complementary and alternative medicines. So these medicines we know have been used in the past. But what is new, which we are learning, is supplements and their problems, vitamins and the problems, vegetables, fruits, superfoods. At times they can cause harms. And especially those which are, not prescribed by doctors, or as Nilesh Doshi had said, that people who are qualified, who are learned. Instead of that, most people are now buying it from supplement stores, especially in the Western countries, or online, unsupervised, unqualified people. Now, we know for sure our allopathic drugs are known to be extremely nephrotoxic, some of them. But indigenous medicines, side effects also must be known by everybody, if we are to avoid them, or if we have to use it with caution and with proper dosage. When I did the study for this talk, I realized that there are foods which lead to kidney disease. I was amazed that large amounts of green leafy vegetables and fruits ingested as juices, smoothies, cleanses, they contain large amounts of oxalate, causing toxicity and kidney disease. And we always now realize and understand why we were avoiding these things in oxalate stone patients, because they are rich in oxalate. There's something called jenkol beans or jering, which is eaten more in the Far Eastern countries along with rice. And jering contains 1 to 2% jenkolic acid, which is a sulfur-containing amino acid. It can cause a very viscous, thick sludge and cause obstructive uropathy and AKI. This was again a new thing. There are certain poisonous mushrooms, oralanin present in these cortinavirus mushrooms, which can lead to diarrhea, vomiting, dehydration, and AKI. Star fruit, again, common in certain parts of the world. It's rich in oxalate and can cause oxalate stones and oxalate nephrotoxicity. In fact, if you give it to CKD patients, that means people who already have CKD, the oxalate will get accumulated, or star fruit can cause neurological symptoms and encephalopathy. Simple chocolate and tea, jo sabko acha lagta hai, and we want to have it in small quantities, good. In fact, both chocolate and tea mein bar you hear about things that they are good for the heart and so on, but they contain high phosphorus. So in CKD patients, they are not good. They contain high oxalate. So stone patients, again, They are not very good. So now these are simple things which we are not even reaching the stage of drugs yet. How there are so many things in the environment which we need to be careful or knowledgeable. That doesn't mean you have to avoid. You have to take the vegetables. You have to take the. We are coming to vitamins. There again, vitamin A is especially given by ophthalmologists, and it's good for eyes. But it can accumulate in toxic proportions in CKD patients if you use it in plenty. This might lead to skin changes, hair loss, hypercalcemia, especially in CKD patients. And vitamin D, of course, is the flavor of the season. For COVID, we use vitamin D. But if you see, vitamin D has been touted as a drug for everything from common cold to cancer. All these people, everybody is giving vitamin D. Unfortunately, it is very good for osteoporosis. But if used in excess, for example, some of the orthopods are using 6 lakhs units injections every week for 6 weeks and then every month and so on. So in such large doses, it can cause hypercalcemia and AKI. And we always thought vitamins are very good. Similarly, vitamin C, again, flavor of the season. For COVID, vitamin C is good. Extremely good antioxidant from common cold to COVID. But again, large quantities, when you use it for CKD patients, it can lead to oxalate. Then, of course, we're talking of a lot of supplements, which I think Alan is going to cover up. A huge number of supplements available in the market, from ephedra to licorice to, and each one has its own issues, which I'm sure Alan is going to cover up. So I thought, what about heavy metals? Now we all, hear about bhasmas and heavy metals, but you don't realize that there is so much of heavy metal in the environment. Lead toxicity is not so much with drugs. Lead toxicity is found in lead-based paint, soil, dust, gasoline, industrial sources, lead pipes में से पानी आता था, that water, cigarette smoke, all this if used, if it's an acute excess of lead, then you can have AKI. If it's a chronic, then you can have CKD. There used to be in past something called Saturnine gout. So that there actually in Rome, I think they used to drink alcohol in large quantities in lead utensils, and that led to Saturnine gout and so on. So lead has been known to cause lead nephropathy. Arsenic, again, groundwater contamination. Remember that drugs, yes, but a large amount is environmental contamination, which also you must work towards it. It's not our job, but maybe the people who look into the environmental aspect will look into arsenic. So again, arsenic problems are there. Cadmium, fossil fuel combustion, phosphate fertilizers, batteries, municipal solid waste incineration, cadmium toxicity. Same way, acute hoga to acute kidney injury and acute tubular necrosis, chronic exposure, CKD. Mercury, of course, we all know that the blood pressure instruments are now banned. The mercury ones are banned. And the dentist used to use it for mercury fillings in the teeth and so on. So dental fillings, BP instruments, so on. But apart from that, mercury is in power plants, smelters, gold production ke liye, and so on. And mercury also causes in kidney what is called as nephrotic syndrome, apart from the standard immune complex nephrotic syndrome, apart from acute tubular disease and all. And then you have uranium, you have aristolochic acid, you have melamine, and all these can cause different ways kidney involvement. Some may cause urothelial malignancy, some may cause interstitial nephritis, and some may cause urinary stones or oxalates. So this is generally how heavy metals can lead to toxicity. You also must have heard of how barium is used in the test, and barium itself could be toxic. Gallium is used in certain radiological examination. We talked of BP instruments. So in medical usage, heavy metals can be used in different forms, but unfortunately the proximal or tubular cell bears the brunt of the entire toxicity. So whenever you have exposure to such heavy metals, it could be acute, it could be intermediate, and it could be chronic. We are worried of the chronic part. The acute one is, you kind of come to know, okay, you have been exposed to a bad environment toxin. But the chronic intoxication is uneventful. It is silent. It can lead to CKD silently. And this is why we are all worried about it. You can pick up the heavy metals by way of certain tests. For example, you can do CBC, LFT, renal function tests, urine analysis. There were new markers which they are studying now. NGAL is one of them. You can do ultrasound to see whether it's an acute kidney injury or chronic kidney injury. And of course, you can measure lead, mercury, arsenic, cadmium levels in certain laboratory. So now this is what I was talking of, CKD-U, CKD of unknown origin. They've been not able to exactly make out the etiology, but there are certain factors which they have thought of as commonly found in these patients. These are people who are doing strenuous labor. They are residing in certain endemic zones. They are more often farm workers. You find some degree of protein. Some of them may have underlying diabetes, hypertension. The injury is again tubulointerstitial. It's generally agricultural community. And these are the hot spots of kidney failure. It was first reported somewhere in Mexico and Central American areas, but in India and Sri Lanka, now we have a large number of CKDU cases, especially in Maharashtra, Andhra Pradesh, Odisha, down south. And a lot of work is going on in this unknown entity. But again, environmental toxins are thought of. For example, if you see, apart from strenuous labor, heavy metals, communicable disease, genetic predisposition in a few, but agrochemicals. So this is another area which we have to worry about. Our soil is contaminated, our food is contaminated, vegetables, fruits, etc. What we eat, this is what is meant by agrochemicals. And of course, as I said in the beginning, environment includes everything under the sun, including the sun. So heat stress can lead to CKDU. So we saw this is the common part in the CKDU. One of them was heavy metals. So why are we having today's lecture? Mainly because of adverse drug reactions of certain drugs used. Now I'm going to talk of allopathic drugs. Alan is going to cover up a bit of herbominerals. But adverse drug reactions are so common. 4% of hospital admissions, 1 in 1,000 deaths in medical wards, 10 to 20% of inpatients. And I'm talking of allopathic, please. 5% of patients in general practice. So you must have a very high index of suspicion, and that is how you should use proper doses to avoid it. Many years ago, Matthew Pryor said that cured yesterday of my disease, I died last night of my physician. So one has to be careful when he uses these drugs. And we have always been taught primum non nocere. First, do no harm. And on that principle, I thought I'll cover up a few adverse reactions of the allopathic drugs. So the brief today is herbominerals, drugs, and CKD. So this is, of course, the erythema multiforme with certain drugs, especially sulfa. This is a simple side effect. Gingival hypertrophy used with antihypertensive drugs like calcium blocker. This is gangrene of the leg with warfarin. These are the dangerous cases. They have ventricular fibrillation, Torsades de Pointes tachycardia. And what did you use? You use sometimes a simple drug like terfenadine. It's an antihistaminic. Khujli ke liye use kiya, sardi ke liye use kiya. But if there are people who are on multiple drugs together, ketoconazole, levofloxacin, ciprofloxacin, then these are the drugs which can lead to Torsades de Pointes tachycardia. So what did we do? We used a simple drug and it led to sudden death. So we know quite a lot of these drugs can cause ventricular fibrillation. So drugs and kidney, why they are important? Drugs can cause renal failure. And more importantly, if somebody has CKD, and which has relevance to today's topic, why one has to be careful as to what drugs you are using in these CKD patients, because the drugs will be accumulated. So all those drugs which were safe become unsafe because of the presence of increased creatinine, because of the presence of low GFR, because of the presence of kidney failure, whether they are allopathic, Ayurvedic, Siddha, any medicine. CKD, it will get accumulated in larger than normal quantities. These are the common allopathic drugs which we talk of when we talk of nephrotoxicity. Painkillers or NSAIDs, aminoglycosides, contrast medium, say which we use for CT scan, and ACRBs. These form the famed quartet of the allopathic drugs which cause problems, and of course diuretics and so on. Now, these are the drugs which lead to allergic interstitial nephritis, whether you are using antibiotics, sulfas, quinolones. Don't worry, these slides will be shared with you. So I'm going fast mainly because there are many speakers. But allopurinol or xyluric, which we use, diuretics, and most important new kid on the block is the PPIs, the antacids used for reflux disease of the GU, gastrointestinal system. But if you use it for a long time, then PPIs also could be dangerous. We talked of contrast in CT scan. But if you use MRI contrast also in renal failure, then you can develop what is called as nephrogenic systemic fibrosis. So the whole arm becomes edematous, hard, woody, and there is no treatment for it. There's also something called hyperphosphatemic acute kidney injury, acute phosphate nephropathy. There are certain laxatives which are used, which contain a lot of phosphate, and the colonoscopy people, they use it for preparation, and that can lead to crystals deposition, calcium phosphate deposit in tubules and interstitium, called crystal nephropathy. So crystal induced acute renal failure is another important thing. So I'm taking some of the uncommon ones. So again, acyclovir, sulfas, anti-obesity drug like orlistat, the ciprofloxacins can cause crystals. There are different ways in which the kidney disease presents. And again, Alan will try and cover up in which way the tubules get affected with herbominerals. So same with allopathy. You could have just prerenal azotemia, acute kidney injury. The drug can cause only hypertension. The drug can lead to glomerular disease. It can lead to CKD. Some of the drugs have only pus cells in the urine. For example, old tetracycline. Some drugs can cause Fanconi syndrome, like tetracycline. Some drugs can cause acidosis. Some can cause only proteinuria or calcium and so on. So there are different ways in which kidneys are involved. So for example, only urea elevation, creatine normal, steroids. Both urea and creatine, many drugs. Some drugs lead to no urea increase, no creatine increase, only sodium and water retention. Patient becomes edematous after consuming it. NSAIDs, steroids. Dr. Raja Ramchandran talked of pioglitazone. It can cause water retention. He was talking a lot about hyperkalemia, and you have to be worried. Again, ACE, ARBs, potassium K-salt, spironolactone he alluded to. Again, potassium sparings. Some cause metabolic acidosis. He told you about metformin. Again, NSAIDs and Dimox, which we use it for mountain sickness, can cause metabolic acidosis. Some drugs cause only increased uric acid, for example, diuretics. And some drugs, there is interaction. Again, Alan is going to tell you about interaction with herbominerals. But I thought I will bring up the problem of interaction in allopathic drugs. And there are so many drugs which just accumulate in renal failure. We can't cover up all of them. So how do you adjust the doses? By knowing the GFR, estimated GFR, and you in your mobile phone you have formula for GFR. So some of the most important last couple of slides are that your creatinine, whether it is increased or not, will decide whether your drug can accumulate in the body. And how do you come to know? The advanced CKD is just the tip of the iceberg. I think Raja Ramchandra again referred to tip of the iceberg. And so that is why the tip was not seen. The creatinine elevation was not seen. The obvious CKD is only the tip of the iceberg. And that is how the Titanic sank, because creatinine surfaces very late. They saw the tip of the iceberg very late. And if your creatinine slowly goes up, the probability of drug-induced toxicity is quite high. So ladies and gentlemen, friends, why we are talking of drugs and nephrotoxicity? Because if you have a CKD and you allow him to not go to a doctor, he gets treated at home with just lifestyle modification and a few drugs, the baseline rate of decline in GFR will be slow. If you use drugs which were not allowed, you use NSAID for gout, you use gentamicin for UTI, you did a catheterization or angiography, and you use a lot of diuretics, he might develop dialysis much faster. So primum non nocere. You don't do any harm is our first motive. And that is why all of us should know what drug toxicity can do. And you must be careful in certain cases like old age, heart failure, cirrhosis, dehydration, and so on. And so ladies and gentlemen, final slide, the key points is that CKD patients are at high risk for all environment toxins. Why talk of only allopathic drugs or herbominerals or heavy metals? All. several classes of drugs can lead to, and they are renally eliminated. And you must always know your GFR of the patient, minimize the pill burden, avoid using too many toxic drugs, avoid polypharmacy for that matter. And you must, as somebody pointed out, as Nilesh Doshi pointed out, you must be aware of your drug which you're using. And of course, there should be a high index of suspicion about drug toxicity. Keep it in mind, when you cannot explain the cause of CKD, consider drug nephrotoxicity. Thank you for patient listening. I did not intend actually to take that much time. I ate into Dr. Alan Almeida's time, but it was so important that we kind of tell you that it is not just the drugs, but there are so many things in the environment which can cause it. So thank you for the patient listening. We will take all the questions at the end if we get time. And may I introduce Dr. Alan Almeida. Alan, are you there in the audience?
Yes, I am.
Alan, yes, not in the audience, but you are the speaker. So Dr. Almeida, actually, I have done my nephrology under him. I have been a registrar under him. I have heard his, rather got his firings, and whenever I've not performed, he has pulled up my ears. He's trained me. He was the head of department at the KEM hospital where we all trained. Presently, he's head of department of nephrology at the Hinduja Hospital. He's a great teacher, teaches not only nephrology students, MD physicians, but primary care physicians also. And Alan is going to take us through the herbominerals. A bit of it I have already eaten into his time as well as topic. Over to Alan.
Thank you, Mr. If I could have the, okay, if you shut down, then I'll.
Yes. So it's like.
Sir, today time is not the criteria. Interaction and amicable output should be the criteria.
Wow, I think there will be people who will listen, and there'll be people who will see it again later on Facebook also. So we have to listen to Alan, we have to listen to Katoj, we have Sashi Kumar, and we have to lay guidelines. So there's a lot of work to be done. I would apologize to the subsequent speakers for the time which I've eaten up and which Alan, please go ahead.
Yeah, thank you, Umesh. Thank you, Nilesh. Good evening to all. Umesh has done, as well as Nilesh has done, and made my job a bit easier. I am not going to be spending too much of time on individual drugs or individual toxins, but I will definitely give you a bird's eye view of what herbominerals, drugs mean to the kidney. Also, Umesh has very rightly brought out the fact that it's not just the product which is of importance, but there are many other aspects which you need to consider before considering the effect on an organ. So, okay, I'm moving on to the next slide. In case you thought that I am anti-Ayurvedic medicines, it's not so. I needed to clarify this. I'm not here to condemn the use of herbal medicines, and that part I will answer at the end of my presentation. So why is the kidney a target? Again, Umesh made my job easy. He's shown that the kidney is the root of excretion of most of the substances present in the herbs. The high blood flow rate and large endothelial surface area of the kidneys ensures delivery of large amounts of toxin to the renal parenchyma. The high concentrations may be reached in the medulla because of active tubular transport, especially during a state of fluid deprivation. And this concentration of these chemicals within the kidney. So this all predisposes the kidney to damage. Now, Umesh has mentioned, all of us know that the evidence is out there. The evidence is in print. The data exists in published literature about both the good and the bad. So if you were to do a literature search, or if you search the internet, you would find both abounding, the good and the bad, effects of herbal minerals or dietary supplements which have been used. But many of the data which has been put together come from case reports. Now, should we be relying on such data? This is in fact my first plea to all concerned that we should be generating data from our country in a scientific fashion so as to lay to rest some of the misconceptions and to give credence to some of the statements which have been made in the published literature. A common fallacy, again, Umesh has mentioned this, is that the majority of people who use these medications consider them to be natural, green, and always non-toxic. I start off with this one review, which came in the Advances in Chronic Kidney Disease, 2016. And this was on the nephrotoxicity of natural products. And here is the whole list of natural products which could have either due to direct or immune-mediated nephrotoxicity or various other mechanisms, including rhabdomyolysis-induced nephrotoxicity, to cause kidney damage. But so these natural products with documented renal damaging effects are there out in the literature. And some more natural products with renal damaging effects like glycyrrhiza or licorice or caffeine with taurine and other products which are there include those which have been natural products but which have been contaminated or adulterated, and this can really contribute to renal damage. Umesh did mention the role of heavy metals, the mercury, lead, arsenic. All this can give rise to kidney damage. Mercury damages the renal proximal tubule, which is so elegantly shown, as well as heme biosynthetic pathways. Lead can cause chronic interstitial nephritis, and arsenic can cause renal tubular necrosis, tubular degeneration, and lymphomonocytic infiltration in the kidney. So you have lead on one hand, but this could be not as a part of the original natural drug, but because of contamination which has entered in its production. So there are a lot of papers mentioning or trying to put together lists of tables where there have been kidney toxicity related to herbs and dietary supplements. Now, this paper published in Food and Clinical Toxicology lists just that. And you will see that on the left-hand part of this slide, that there are various types of kidney injury. There could be nephritis, which is an inflammation of the kidney, of all the structures within the kidney, the nephrons that comprise of the glomeruli, the tubules, or the interstitial tissue. You could have the formation of nephrolithisis or stones. Umesh did mention about oxalates and oxalate stones. I talked about rhabdomyolysis. That's where the muscle is damaged and the myoglobin can damage the kidneys. You can also lose protein in the urine and in the state of nephrotic syndrome. There could be direct toxicity to the tubules, which I've already mentioned, causing either because of lack of blood flow, could cause ischemic necrosis, or there could be toxic damage to the kidney. Another thing which has been mentioned before is the causation of urinary tract carcinoma or cancer, especially with one of the chemicals which I'll mention later. So you can have a whole range of types of kidney injury, which ultimately results in end-stage renal disease and requires dialysis, a kidney transplant, and may even result in death. But if you look, as I mentioned, many of these dietary supplement issues, the dietary supplement induced kidney injury arise from case reports. Now, is that enough to say that this is a dietary supplement which is known to cause kidney damage? Or is it just a one-off case? Is it just an anecdote? Now, this is the paper which appeared, a review which appeared in the Clinical Journal of American Society of Nephrology, and talking about Chinese herbal medicine. Some years ago, when I was part of the Commonwealth Global Advancement in Nephrology team, which went for the African Congress, I came across a prominent nephrologist, Dr. Mark DeBoer, who addressed the audience, and he said that more than 30 to 40% of patients, he had just arrived from Taiwan, So he says more than 30-40% of patients there have uh, tubular damage. In the kidneys are damaged. There's a tubular interstitial nephritis related to herbal medicines. And this has subsequently been proven by various papers which have come in the published literature. Now, in this review, they've shown that there are many nephrotoxic components from herbs, like arsenic acid and other plant alkaloids, plus the anthraquinones, flavonoids, and glycosides from herbs. And these are all known to cause kidney toxicity. And the manifestation is, as I've shown before, there's acute kidney injury or chronic kidney disease, nephrolithiasis, rhabdomyolysis, Fanconi syndrome. This is something to do with the proximal tubule of the kidney being damaged, and urothelial carcinoma. And the factors contributing to the nephrotoxicity of these herbal medicines include the intrinsic toxicity of herbs, incorrect processing or storage, adulteration, contamination by heavy metals, incorrect dosing, and interactions between herbal medicines and other medications. The exact incidence of kidney injury due to this nephrotoxic herbal medications is not known. However, we should be looking in patients who have unexplained acute kidney injury or progressive chronic disease for any consumption of medications, herbs, etc. So we have here a list of medicines, and if you see on the extreme left of your slide is the Arsenic acid, which has been now been better investigated, and we know that there its role to play in the nephrotoxicity. And then we have all these various Latin, English names and the Chinese names of the same active ingredient, and they all associated with nephrotoxicity. Here's a further set, again, not going into detail. This is basically what they do and the manifestations which I've already made known to you in the previous slides. So when you look at the kidney, there are factors which damage the kidney. One is the herb-related factors, something which is intrinsic toxic to the toxicity of the herbs. Umesh has mentioned about the allopathic drugs which you use and how some drugs are known and notorious to cause kidney damage. So also certain herbs have a potential toxicity to the kidney. Sometimes these herbs are not identified properly and find their way into the medication or the formulation, or they may be processed incorrectly, or even storage at times may be improper. And of course, adulteration, be it man-made or in nature, and contamination by heavy metals. This again is something which Umesh has very aptly brought out, that even the water source, the soil source, all are contaminated, and the degree of contamination is increasing day by day. Also, if you look at the treatment factors, sometimes we continue medications even longer than the time they're supposed to. And there could be interactions between traditional drugs from Chinese medicine or otherwise. And sometimes there are patient factors which predispose a patient to development of a kidney injury. So it could be a clinical condition, chronic kidney disease or allergy, or they could be even sometimes a difference related to the gender and the age of the patient. Again, another review from herbs in the kidney. In most countries, herbal products are not required, regulated as medicines, but the herbal poisoning may be a secondary to the presence of undisclosed drugs or heavy metals, interaction with the pharmacokinetic profile of concomitantly administered drugs, or associated with a misidentified herbal species. So these are other reasons why the herbs can damage the kidney. Again, listed here on the left side, the various kidney syndromes associated with herbal medicine: hypertension, acute tubular necrosis, acute interstitial nephritis, Fanconi's, papillary necrosis, chronic interstitial renal fibrosis, urinary retention, kidney stones, and a urinary tract carcinoma. Now, there are examples of risks of herbal medicine in patients with renal disease. And some of which are important to the treating doctor. Now, if you take this product containing this herb, then they can decrease the blood levels of cyclosporin and tacrolimus. This can result in damaging effect to the newly transplanted kidney, because these levels of the immunosuppressive drugs going low would mean that the patient would undergo a rejection. Or there could be hemorrhagic complications with ginkgo biloba, or hypokalemia with glyceric acid. The licorice which I talked about, that's this. Rhabdomyolysis, muscle damage with this herb, or the ephedra alkaloids causing hypertension, or the alfalfa, dandelion, noni, and juice, which can cause hyperkalemia. Now, this would have uh, definitely more implications when you're looking at a patient who has already got a kidney disease. Again mentioned by Umesh, kidney and heavy metals. And this is the role for need to evaluate the environment in which your products your plants are grown, and also the various other things which could enter into the production. And when you have heavy metal toxicity, you have a lot of other things which come into play. If you are unfortunately the victim of a heavy metal toxicity, you need to have measures to lower that. And these are the various extracorporeal methods of treating such heavy metal toxicity: hemodialysis, peritoneal dialysis, and the hemodiafiltration or hemofiltration, plasma exchange, and the other things which are chelators, which we tend to use. And this is hemoperfusion. Now, these are all the metals which can be tackled by some or another of the various therapies which are available. Now, in our studies, nephrology studies, we do include a chapter on toxic nephropathies. One part of which is the, as Umesh talked about, the CAM, alternative complementary products. And there is where we talk about astrolochic acid, the ephedra species, glycyrrhiza, datura, taxus, celebica, capes aloe, and digata. I'm sure I'm mispronouncing many of them, but these are the ones which find their way into the various textbooks, because they are the ones which have got more information regarding the damage to the kidney. But in addition, there are other things. A major concern is that although many of the substances are innocuous, even those that are safe may contain harmful contaminants and chemicals, which I've already mentioned. Umesh also has done the same. And there are heavy metals, include lead, etc., which all can give rise to damage to the kidney. So there is specific pathologies associated with traditional medicine. They could be acute tubular necrosis, and the whole set of herbs which are associated with acute tubular necrosis, or they could be acute interstitial nephritis, where the kidney biopsy, there would be a presence of a lot of eosinophils. Again, many of these products, hepatorenal syndrome, that's both the kidney and the liver are damaged at the same time, or muscle injury, or they could be damaged to the tubules, especially the proximal tubule, where you could also have, in addition to acidosis problem, you could excretion of glucose, amino acids, etc. Or there could be an inability to concentrate. So there's diabetes insipidus. That means a lot of passage of large dilute urine. Or there may be damage to the filters, where there is a loss of proteins. Or all this is associated with interstitial fibrosis, stones, rejection, etc. This is an article which Vivekanand Jha wrote in Nephrology, again addressing how edible plants are associated with chronic kidney injury. A whole list of them, and some of which have already been mentioned by Umesh, and these are the various toxic compounds: arsenic acid, ephedrine, glycolic acid, oxalic acid, glycyrrhiza, all which I've mentioned earlier, plus the heavy metals. And the manifestations come among all those which I've already listed. But there are ways, if you have toxicity which is going to be produced by the aristolochic acid, it follows this pathway of of toxin, the development of products which will eventually land up in urothelial cancer, or you have the one where it gets detoxified. And what are the clinical features of aristolochic acid nephropathy? There's a progressive decline in the glomerular filtration rate. There's evidence of proximal tubular dysfunction. There's glycosuria, increased excretion of low molecular weight proteins, minimal low albumin in the urine, no swelling or blood pressure. There's severe anemia, metabolic acidosis, and eventually the kidneys become contracted. Somewhere down the road, there will be urothelial malignancies. So this is the one which has been researched well in depth, the aristolochic acid nephropathy. So you have now the toxicity of herbs, vitamins, and supplements. And if you see in the United States, the Food and Drug Administration regulates the efficacy and safety of pharmaceutical drugs. In contrast, the Food and Drug Administration also regulates the use of vitamins, minerals, herbs, or botanicals as dietary supplements, banning specific medical claims but requiring no documentation of efficacy. So the Food and Drug Administration regulates the use of vitamins, minerals, herbs, or botanicals as dietary supplements. They may in fact contain actual pharmaceuticals or nothing of value and have significant toxic potential. We know that the Chinese herbal medicines cause nephrotoxic syndrome, which I've already described, and the soil contamination with heavy metals leads to bioaccumulation in both herbal and medicinal plants and potential toxicity. Remember, bad, spicy news gets better coverage. However, very few good news stories are made. So what I would like at the end of this talk is to ensure that also the good news is told. There are herbs which are called as healing herbs for any ailment. Then there's now articles which are rising which talk about medicinal plants and how they are able to protect the kidney from the damaging effects of medicines. So you can see in the highlighted portion here that the curative effects of a variety of medicinal plants against drug-associated nephrotoxicity. And this is something what we would now like to identify. So herbal medicine or herbominerals do not just have a one-minded or one target of toxicity, but they can also protect the kidney from toxic occurrences. So medicine plants may not just cause, but could be curative too. And here are some papers again from the literature, plant-derived agents for counteracting cisplatin-induced nephrotoxicity. Cisplatin finds large usage in our oncology patients, anti-nephrotoxic activity of some medicinal plants from tribal-rich pockets of Odisha. So all these are something which we are looking forward to. We are looking only to allopathic medicine, but if we have this, it will make our life easier. When we, as a train our students, we also talk about looking whether there is anything else which the patient can volunteer, which could possibly have resulted in the damage. As I mentioned earlier, if there's an unexplained acute kidney injury or an unexplained chronic kidney disease, look to intake of medicines or dietary supplements which could possibly have damaged the kidney. So this is from National Kidney Foundation website, where they're looking at herbal supplements and kidney disease. So which herbal supplements have potassium? Why? This makes our life more difficult in patients where we have to restrict the potassium, which can have any of the cardiac arrhythmias and any such issues. So we need to have knowledge of these products, because then we will know that this is the reason why. I'll give you an example. Now you have in the market common salt. One is the regular iodized salt. You have some which say low sodium. So their patients automatically go towards that. And then they land up consuming more potassium because the sodium has been replaced by potassium. So in fact, that light salt is nothing but a potassium salt rather than a sodium chloride. But that means a more potassium load for the patients who have already got a difficulty in excreting the potassium load. So this is something which is exemplified by which herbal supplements have potassium, which herbal supplements have phosphorus, because we know when the phosphorus levels rise in the body in chronic kidney disease, we have an issue of vascular calcification. And if you realize the patient with chronic kidney disease is more prone to developing cardiovascular disorder, cardiovascular morbidity, and mortality. So another thing is which herbal supplement should be avoided if you have kidney disease. So this is something whereby the physician or the patient can realize that this is something which I need to be wary of. Otherwise, we could complicate the management. But what are the factors that contribute to the nephrotoxicity of traditional medicines? Umesh has mentioned too, contamination of the traditional medicines with various things, maybe heavy metals or maybe even other plants which are toxic, or I read erroneous identification or preparation of the medicinal product, incorrect use or administration of a remedy, giving a too long a dose, too long a course of medicine, or there may be concurrent disorders in the patient which can complicate issues, or the patient's characteristic, patient who is now in losing fluid and electrolytes from the body because of diarrhea could, and if receiving this medication, could land up with issues, or there could be interaction with other medications. So how do you prevent nephrotoxicity associated with herbal medicine? The main principles would be increased attention should be given to the possible nephrotoxicity associated with the herbal medicine, the appropriate preparation, the co-medication that has already been prescribed to the patient. So this is where the interactive nephrotoxicity occurs. Preclinical, pharmacologic, and toxicological assessment of herbal medicine is recommended before widespread use. Extreme caution should be observed when using herbal medicine associated with nephrotoxicity, and avoid herbal medicine overdosage and long-term use, and carefully record all cases of adverse reactions, be it allergy or kidney function derangement. Now, this is something which in allopathic, there is also what is called as the post-marketing surveillance which goes on. This should happen for Ayurvedic drugs or herbal medicine usage, and develop a much stronger and more stringent system to manage toxicity in herbal medicine. These again are preventive measures against prescription drug or dietary supplement induced nephrotoxicity. As I said, patients who already have a low GFR, they have a pre-existing renal disease. So avoid drugs in these populations which are vulnerable. I talked about volume depletion, multiple nephrotoxin exposures, patients who have received a kidney transplant, diabetes, high heart failure, and sepsis. And when you're prescribing, ensure that they use equally effective non-nephrotoxic drugs if available, and correct risk factors for nephrotoxicity prior to administration of these drugs. Adjust according to the level of kidney function, and ensure hydration, avoid other nephrotoxic combination, and avoid erroneous herb identification, something which you would probably know better than I do, and assess baseline kidney function and monitor the same as when you give the treatment. So we're looking at the factors, the raw material, collecting, transport, storage, processing, storage, and packing, and the finished product. All these are targets to ensure and monitor that the product which is eventually reaching the patient is safe for the patient. Now, is toxicological analysis required for traditional medicine? This is the question which has been posed. And some may say, no, it's not necessary. It's been there, being used for generations, and the long history of use without any issue. Or there's a well-established system, and experts can guide whether this is a fact or not. So cost, laboratory infrastructure, and time is something which is on the negative side. You have to invest in cost and in laboratory infrastructure, and also give your time so as to monitor these toxic occurrences. And the other group might say, yes, why not? Absence of adverse drug reaction documentation is not the absolute assurance of safety. Now, many of the side effects which have occurred in allopathic medicine have been because of observation made by someone and reported to someone. So that's why even now, when permission is given by the drug controller to market a product, or to rather to give the permission to introduce it in the Indian market, you are also asked to provide data of post-marketing surveillance. So certain effects are difficult or even impossible to detect clinically. There are novel manufacturing methods and changing ecological environment. This is something which I want to stress again and again. Use of pesticides, according to newspaper reports, etc. The soil water in our granaries, in the places where we get all our grains from, are contaminated. And that could be another reason why Umesh has already mentioned about CKDU, which is there in Maharashtra, Andhra, as well as in Odisha, and even in Sri Lanka and other places across the country. And this could be because of the alteration of chemical, toxicological, and pharmacological profiles. Now, if you're taught that I would be anti-Ayurveda, no, I'm not. I just want to provoke you to find answers to so many questions. And, we have a different frame of mind. We should be using the drugs which we, as Nilesh rightly pointed out, if you know all about the drug, then we should be using it. Thank you.
Thank you, Alan, for this elaborate discussion on herbominerals. As you rightly said, that it will lead to a lot of introspection, a lot of discussion. And before you came, we were discussing between me and Dr. Katoj that what we as allopaths or nephrologists see is the red bulbs, occasional effects, while predominantly the Ayurvedic people who are treating, they see the green bulbs, the efficacy, the usefulness, and so on. And you also pointed out that the rare cases which get reported are the ones which we are trying to bring it out in front of the primary care physicians. But now we will hear from the Ayurvedic experts as to what is their approach and what is their frequency of these issues which they come across. So Nilesh, over to you to introduce the experts in this field.
Yeah, sir, as I suppose the Ayurvedic fraternity does not need the introduction of Dr. Katoj, sir. He is very well-known personality in the field of Ayurveda. He is the advisor, Ministry of Ayush. He is the he holds third position in the ministry. After minister, the secretary, and after secretary is the third one. He is the person. There are two advisors, and he is one of the advisor who is the in charge of drugs. And selection of him as a speaker today is that let him throw the light from the entire country point of view, that what Ayurvedic drugs are, and what he wants to convey to the Ayurvedic fraternity uh, from the drugs point of view. And I'm sure that he's going to cover uh, this the dravya, some information about Vishtantra, guidelines for giving the herbomineral drugs, complications of substandard manufacturing, simultaneous use of multiple herbomineral drugs, side effects of long-term use of herbomineral drugs, and precautions while using it for a long term. I suppose he is going to cover all these aspects in a scientific perspective. And then I will take it over to Dr. Sasi, that how does he practice this herbomineral preparation. So over to you, sir. It's my pleasure and privileged to present you in front of this August gathering and the first ever such interaction in the field of integrated course. Thank
Dr.
you.
Katoj, welcome. We are waiting to
Thank you.
hear from you.
Thank you.
So that
Thank you.
we get a
Thank you.
proper perspective. Yes.
Thank you. Thank you.
All right.
First of all, let me congratulate the organizers that they have started this course, the Global Integrated Certificate course in urology, and the approach is integrated, means the experts from both the systems, from the Ayurveda side or from the I would not say the allopathic side. Because if you see the books of allopathy, you will not find the word allopathy. You will not find the word allopathy in that. So medicine is medicine. Medicine is medicine. Medicine is medicine. We cannot name it that this is Ayurvedic medicine or this is allopathic medicine or the modern medicine. Or the
Yes.
Medicine is medicine. And medicine is meant for healthcare of the people. No, there could be two different approaches. So before I discuss that, let me congratulate Dr. Khanna and Dr. Ramchandran and Dr. Alan. I think they touched upon many important points which the practitioners on both sides, I will not that what are those both sides, they need to understand that, okay, what due care needs to be taken while prescribing medicines, by prescribing drugs. No, frankly speaking, I believe that the medical knowledge, I think it is just like a river. It is a river. So one group of practitioners, means which we call as Ayurveda practitioners or other, they are standing on one bank of the river, and the other practitioners, they are standing on the other bank of the river. So they see each other, but that merging is not possible because the principles and the concepts, they are different. They are different. What we can do, and I think that has already started, I think through this series of symposia and series of these lectures which are organized, that we need to develop live-in relations. So live-in relation, that requires to be developed. And I think we cannot marry each other, but we can live in. We can develop live-in relations. I think with that, what will happen, whatever treatment gaps are there, whether the gaps are there in the Ayurvedic side or the gaps are there in the allopathic side, those gaps can be narrowed down, those can be bridged. I think by mutual exchange of knowledge, by mutual exchange of what we call as integrative medicine. Now in our country, the practice of integrative medicine, it is very, very difficult because the rights and privileges given under the respective acts, they do not allow integrative medicine. One practitioner cannot do practice of integrative medicine. This is also true, right? So, but there are other things, means the cross-system referral. Cross-system referral, because after understanding the limitations of the one system, and then, but the practitioners of the other side should also be aware of that what are the strength of his system. So awareness of the strength of the system, the potential of the system, that is very, very important. Now, if you see the drug, now I will start from drug. Now, drug in Ayurveda, if you see the Drugs and Cosmetic Act, when it was conceptualized in 1940, there was only one single definition of drug, and that included all kinds of drugs. Whether it is herbal drug or mineral drug or phytopharmaceutical drug or pharmaceutical, all kinds of drugs. It was only in 1964 when on the recommendation of the first Pharmacopoeia Committee of Ayurveda Pharmacopoeia Committee, which was set up by the government of India in 1962, they recommended that the definition of drug needs to be bifurcated. So in 1964, the definition of Ayurveda Siddha Unani drug came into being in the Drugs and Cosmetic Act 94. And today, we have 4 kinds of drugs which are regulated under Drugs and Cosmetic Act. The first is pharmaceutical drug. Second category is Ayurveda, Siddha, Unani drug. For all these 3 kinds of drugs, the provisions are regulatory provisions are same. And then the third category is homeopathy drugs. Homeopathy drugs, they have exclusive provisions. They are not common to Ayurveda, Siddha, Unani drugs. And then the new category, I think just 4 years back, that category has been introduced, and that is phytopharmaceutical drugs. For the information of the house, all those who are present in this symposium, there is no category as herbal medicine. We have talked so much about herbal medicine, herbal product. There is no category as such, which is we call as herbal products or herbal medicine in our country. It is either pharmaceutical drug, phytopharmaceutical drug, homeopathy drug, or Ayurveda, Siddha, Unani drug. Now, this herbalism, this concept of herbalism or the herbal products, it has come from Germany. Means in German, they started isolating certain molecules or certain constituents or isolates of some derivatives of the plants, and then they developed this herbal drugs. But they are not system-based. They have not been developed on the principles and the concept of any system. But in our country, in Ayurveda, Siddha, Unani, and homeopathy, there are certain concepts and manufacturing methodology, then the standardization, the so many aspects means those are already covered. Now, if you see, I think the many people, they do not know that we have standards of our drugs. Now, the work of standardization of Ayurveda, Siddha, Unani drugs, it started in 1964, and today I think more than 2,000 drugs, they are described in the pharmacopoeia, in the formularies. So standards are there, and in those standards, this permissible limits of heavy metals, permissible limit of the aflatoxins, pesticide, microbial residue, microbial count, everything is there. So all the parameters which are there for the conventional medicines, the conventional drugs, all are there. Now, what is happening? If you see the Ayurveda, Siddha, Unani drug as a whole, they are made from wholesome ingredients. They are not made from some isolate or some phytoconstituents or some phytomolecules. They are wholesome. Now, this phytopharmaceutical category, again, this is more close to pharmaceutical drugs, and they are not regulated under the provisions for Ayurveda, Siddha, Unani drugs. It is not regulated by that. So Ayurveda, Siddha, Unani drug, they are the wholesome, maximum up to extract. Again, that extract is wholesome, not any fraction like some alkaloid or like. I just give you two examples, then you can easily differentiate that what is the difference between a chemical drug and a natural Ayurveda, Siddha, Unani drug. Now, I think you might have heard about this Reserpine. No, Reserpine, it was derived from raw Wolfia serpentina, which we call as Sarpagandha, right? So when it came to the market, just after 2-3 years, it has to be stopped, because with the use of this Reserpine, the people, they developed suicidal tendencies, severe depression. So it was out of the market within no time. Another drug, that is carbonoxolone. It was developed from Glycyrrhiza glabra, anti-ulcer drug. But when the people, they started using this carbonoxolone, the male patients, they started developing gynecomastia. And again, it was stopped. But we are still using Sarpagandha. We are still using Glycyrrhiza in the wholesome form. And we are not finding the patients that they might reporting some adverse effects or other things. So this is one thing. Now, in the Drugs and Cosmetic Act, there is a schedule. There is a schedule even where there is a list of potentially toxic or poisonous medicinal plants and the minerals. That list is there. And if any ingredient out of that list is used in the manufacturing of any Ayurveda, Siddha, Unani drug, so that particular product has to be consumed under medical supervision, not without medical consultation.
Okay.
Unfortunately, in our country, what is happening, the people, they are resorting to self-medication.
Correct.
They take the medicines, they purchase the medicines from the chemist shop, and they start using that on their own without consulting the doctor. And the sad story of this is that in 2004, I think you might have read that article written by Dr. Sapper of USA, when he picked up 70 drugs, 70 Ayurvedic drugs from the US market, and all those were sold there as food supplements, and they had not gone there through the proper channel. They were not exported, but the export was the suitcase export.
Yeah.
So those were not exported under the regulatory provisions. So it was a suitcase export, and the people, they started using that. Yes. And he found that the titer of some of the heavy metals, that was very, very high. Now the point is, in some of the Ayurveda, Siddha, Unani medicines, the minerals or the heavy metals, they are the ingredients by design. They are not the contaminants. By design, they are the ingredients of those formulation. But again, these ingredients are not used as such. They are not used in the manufacturing of Ayurveda, Siddha, Unani medicines in elemental form. Lot of pharmaceutical processing is done, which we call as Shodhana, Marana, Bhasmikarana, Amritikarana. And by virtue of these processes, by virtue of these pharmaceutical processes, these drugs are rendered therapeutically safe and therapeutically effective. But if the proper manufacturing procedure has not been adopted, so what will happen? The quality of the product will be compromised. And if that product is consumed by the person, there could be adverse effect, there could be toxic effects. And there are other factors also, as Professor Alan pointed out. There are so many factors. What is the condition of the milieu interior? What is the condition of the milieu interior? Now, I tell you one plant like this Plumbago gelanica, Chitrak. It is very good. It is very good appetizer and digestive. But if you slightly increase the dose, or if you take more frequently, immediately the blood will start coming in the urine. But this plant, I think it is not mentioned in any of the list which you displayed. Yourself displayed, Dr. Allen. I think the most of the medicinal plants, I think they are from Europe or from America, not from India. It is only the Glycyrrhiza glabra and the Glycyrrhiza glabra, and then the Echinacea and one more plant. But again, the difference is those plants, they are used in Ayurveda, Siddha, Unani medicine in wholesome form. In wholesome form. And secondly, not alone. They are mixed with some other plants. Now, the principles of manufacturing of Ayurveda, Siddha, Unani drugs, if you see the literature, our ancient literature, hardly any medicinal plants, they are recommended to be used alone. So combinations are there. Combinations are, and why these combinations are there? Because by adding other ingredients, the bad effects of that drug could be reduced, or there could be certain ingredients which can catalyze the action, the pharmacological action, or the therapeutic action of a particular ingredient, or to inhibit the bad effect of that ingredient. So like, I think you might have seen that in most of the Ayurveda, Siddha, Unani formulations, this ginger is there. Then this piper longum is there, or piperine is there. This black pepper is there. Now, why it is used there? It is for bio-enhancing effect. They enhances the bio. So that is why the dose of the total formulation that is reduced. I know, I think the studies are there that even for the anti-tubercular drugs, when this Tricotu was added or the piperine was added, piper is there in the piper longum and in the this piper nigrum in kali mirch jo hoti hai aur jo pipli hoti hai usme jo hai piperine hoti hai, and when you add piper to this anti-tubercular drugs, the dose of anti-tubercular drugs comes down. So these kinds of things, but our general practitioners, I think, again, this problem of self-medication, the self-medication and this cocktail medication. I worked in CGHS, in the CGHS hospital. There were 2 units, one the allopathic units and the Ayurvedic units. I used to sit in the Ayurvedic units. The patients, because they know that they will get free treatment, the free medicines. So first of all, they will go to the allopathic doctors, even for cough, even for a common cold, or even for means indigestion. They first go to the allopathic doctor, or then they will come to the Ayurvedic doctor. And to the allopathic doctor, they will never tell that I have taken Ayurvedic medicine and these Ayurvedic medicines I am taking.
Yes.
So this, so with an assumption that by adding 2 medicines, they will have more good effect. So that does not happen. Rather, there are chances of drug interaction, or sometimes the medicine, they may neutralize the effect of each other. They may neutralize the effect of this. So the important thing is, if you see the Ayurveda, Siddha, Unani drugs, there are 3 categories. One, the purely herbal, means those who are made from purely plant materials. And these drugs, those which are made from wholesome plant ingredients, they are regarded as you can say, generally regarded as safe, generally, except of those plants which are mentioned in the Schedule E1 of the Drugs and Cosmetic Rules. Some plants like this aconitum, like Plumbago gelanica, similarly this Abrus precatorius, then aconitum. So there are 6 or 7 plants which are potentially toxic, and those plants, they are not used as such in the preparation of Ayurveda, Siddha, Unani. So some sort of pharmaceutical processing is done that we call as shodhana. Shodhana means to nullify the bad effects, the potential bad effects of that drug. And after that, then the dose of these plants, that is also very less. And another recommendation in the literature is when you are to use that particular plant or that ingredient, there must be a specific vehicle to be used. Like special recommendations are there, like it should be consumed with this particular juice, or it should be used only with honey. Like most of the drugs which are recommended for gastrointestinal disorders, they have been recommended to be used with takra, with chach, because chach, that is rich in lactobacilli. So it may not aggravate the gastrointestinal upsets. So that kind of advice is already there, but it is not being followed. So the people, what they do, they start using with consuming those medicines with simple water, or even the practitioner does not give that kind of advice. But if you see the literature, now our literature is around 5,000 years old. The first documentation that was in the Vedic literature, and the first compendium of Ayurveda, that was written 3,000 years back, Charak Samhita. And Charak Samhita, actually, I think it is a book of philosophy of medicine, not of Ayurvedic medicine. It is a philosophy of medicine, all the aspects of medicine. And another important point is that the role of drug as such in Ayurvedic treatment, it is hardly 25 to 30%. 75% of the role is lifestyle modulation. I think this has been duly emphasized in the presentation of Dr. Ramchandra. He started with lifestyle. He started with lifestyle, and he ended his presentation with lifestyle intervention and lifestyle modulation. So that aspect is very, very strong. But in our practice, I think our practitioners and our patients, they have just one example. Now, in first chapter of health protection, which is in Charak Samhita, in the first chapter, what it says that get up early in the morning, right, and go to bed means early night, early part of the night. No, आजकल क्या हो रहा है कि आदमी जो है वो 23 तारीख को उठता है, सोता है 24 तारीख को है। और 23 तारीख को भी उठता है तो कितने बजे उठता है? 9 बजे उठेगा, 10 बजे उठेगा। नॉर्मल जो क्या कहते हैं, नॉर्मल जो रिकमेंडेशन है इन अवर, और जो ट्रेडिशन भी रही है, वो ये कहती है कि अराउंड सनराइज उसको कहा गया है कि ब्रह्म मुहूर्त, मतलब सूर्य निकलने से पहले। पर आजकल क्या होता है कि क्या कहते हैं हम, तो वो जो बायोलॉजिकल रिदम है, क्योंकि एक नेचुरल जो अंदर सिस्टम है डिटॉक्सिफिकेशन का, वो भी डिस्टर्ब होता है। ठीक। अच्छा, दूसरी चीज, हमारा जो ट्रेडिशनल फूड था, जो ट्रेडिशनल इंडियन फूड था, वी आर गोइंग अवे फ्रॉम दैट। ठीक है, तो हम क्या है, सिंथेटिक फूड या प्रिजर्व्ड फूड। अब जैसे कि आपने बताया कि पेस्टिसाइड्स आर देयर, तो प्रिजर्वेटिव्स, अब वो जो प्रिजर्वेटिव, कलरिंग एजेंट्स, एंटीऑक्सीडेंट्स हैं, और वो जो टेस्ट एनहांसर्स हैं जो डालते हैं उसमें, दे आर आल्सो हार्मफुल। And fortunately or unfortunately, what I can say, that these have been allowed in the manufacturing of drugs in the name of excipients. In the name of excipients, these have been allowed. But if you see the classical Ayurveda, Siddha, Unani medicines, which are documented in the literature for the last 3,000 years, and the practitioner who make the those formulation as per those method of preparation, I think they never come. Now, the regulations in our country for Ayurveda, Siddha, Unani drugs, the point which Dr. Alan made, that this safety monitoring, the pharmacovigilance, post-market surveillance. So when I came back from WHO, I worked in WHO for 3 years, and when I came back, the first point I emphasized that we must start safety monitoring of Ayurveda, Siddha, Unani homeopathic drugs. And I am happy to inform that for the last 4 years, we have set up 74 pharmacovigilance centers across the country for safety monitoring of Ayurveda, Siddha, Unani drug. There are 5 intermediate centers, and one is a National Pharmacovigilance Center, and that national center is All India Institute of Ayurveda, and they are coordinating the whole program. And every day we are getting reports, and particularly these reports are coming about 2 things. One, the misleading advertisement of Ayurveda, Siddha, Unani homeopathy drug, and secondly the ADRs. Since I am getting the reports from the centers, what I have seen that most of the reports, when I examine them, most of the reports, when there is combined use of both kinds of drugs, when there is concomitant use of 2 sides of drug. But if the standalone use is there, only single drug means the drugs of the a single system, I think then the chances of the ADR or adverse effects, that is less. This is very, very important. Now, how to address this issue means at the clinical level, how to address this issue. So the most important part is that first is for the Ayurvedic clinicians or the Ayurveda, Siddha, Unani clinicians, the important thing is when we prescribe a drug to a patient, whether it is a kidney patient or a diabetic patient or a heart patient, whatever, first of all, we need to diagnose the patient Ayurvedically. That we don't do. We simply see the reports, the medical papers of the patient coming from the other side, and on the basis of that. So unless you translate the allopathic diagnosis into the Ayurvedic diagnosis, you cannot give a judicious prescription. This is very true. Because our prescription that has to be based on the physico-psychological characteristics of the individual, which we call as prakriti. Physico-psychological constitution of the patient, that is important. वो क्या है, ये गर्म है कि ठंडा है, उसकी तसीर कैसी है, उसकी टॉलरेंस कैसी है, ये सारी चीजें, all these needs to be taken into consideration. अगर मान लीजिए क्या कि वो जो है गर्म तसीर का है, if the person is of hot temperament, then the hot medicines are not to be prescribed. But these things are not taken into consideration. This is the foremost important point, that the translation of the allopathic diagnosis. When we see that, okay, it is a end-stage renal disease. Okay, it is end-stage renal disease. What in Ayurvedic terms, what it is? At what stage it is? This is very, very important. Just before this corona outbreak, I was in a WHO meeting in Hong Kong. So that was on traditional medicine. One made a presentation. I think one expert from Hong Kong made a presentation, and after that, my presentation was there. He pointed out that in the society, if you see, the percentage of healthy people is very less. Very few people are 100% healthy. And there are more people, those who are sub-healthy. They have no apparent disease, but they are indisposed. Means they are not feeling, they are not well-being, means their quality of life is disturbed. And then there is a segment of people, those who are not diagnosed that they are suffering from some disease, but their biochemistry is disturbed. Like lipid profile is deranged, or the thyroid profile is deranged, or the liver profile is deranged, but they are not having any clinical symptoms, right? Then it is the fourth stage where the people, they have clinical symptoms, signs and symptoms. I think that is the stage when the people, they go to the doctor. So at that point of time, they go to the doctor, because unless, if you see that definition of disease means when the ease is disturbed. So when the ease is disturbed, only then the person goes to the doctor. Otherwise, as a routine checkup, even the government officers, every year they go for the medical investigations. So if the disturbance is there, but even they may take some advice, lifestyle advice, but they don't take any medication. So this is important. Then now there are certain diseases, there are certain people, means those who are diseased, but there is no medicine for managing that disease. So how to address that issue? When the treatment gap is there, I think we need to come together. We need to sit together. We need to prescribe together. And that prescription may not necessarily be in terms of drugs. It could be in terms of lifestyle intervention. It could be in terms of do's and don'ts based on Ayurveda principles. I give you one example. I was attending one conference in Ireland Institute of Medical Sciences. It was on reproductive biology. So during the lunch break, I simply asked the head of the department that, doctor, I have just one query. Means in our tradition, in the Indian tradition, the ladies, the girls, they are restricted to consume certain things during menstruation. Don't take spicy food or salty food or sour food. So have you studied that? What is that? No, doctor, this what will happen? Okay, I will do one study. So just after 2 months, I got a report that she studied a group of around 20-30 girls during menstruation and the eating habits. She noticed that there were pH changes in the vagina, and because of that, the chances of infection were more there. So means when we talk about the milieu interior, the lifestyle plays an important role, and the lifestyle should be balanced. We say that the lifestyle should be balanced, but unfortunately, there is no standard lifestyle which can be adopted by all. There is no, it has to be individualized, it has to be customized, right? And again, it depends upon the physico-psychological characteristics of the individual. So when the lifestyle of the person, of each person is different from the other, it means the prescription coming from the practitioner, that should also cannot be the stereotypes. So because of this stereotyped medication, stereotyped prescription, I think the bad effects of the drugs which are coming. This is one reason. So how to address these issues at the clinical level? So the first point I told that the diagnosis means if it is a diabetic nephropathy, if the patient is coming with the medical papers and on the medical paper is written, okay, and stated diabetic nephropathy or like that, the responsibility or the duty of the Ayurveda practitioners or the Siddha Unani practitioners is first to convert that diagnosis into Ayurvedic diagnosis. In terms of Ayurvedic diagnosis, then that disease needs to be understood. Then you can give the right. Secondly, the quality of the drug that has to be ensured, that whether that drug has been properly manufactured or not. Now, we in the country, this GMP is compulsory. Now, many of our companies, in the last 5 years, when we introduced this the scheme of WHO GMP certification, as on date, around 27 companies, Indian Ayurveda companies, they are WHO GMP compliant, and they are exporting to 105 countries. So, selection of drug means what is your drug of choice when you prescribe, of which company. So that is also important. So the quality of the drugs, properly manufactured drug, that not any kind of drug. Last year during the parliament session, suddenly there was one question that some incidents has happened in Tamil Nadu, and one practitioner, he was a traditional medical practitioner, means the Siddha practitioner, and he prescribed certain, he dispensed certain medicines, and the people, they died. And on the next day, it was in the newspapers, and a parliament question was asked. So when we collected the information from the state authorities, you will be surprised to see that doctor, so to convince the authorities, he consumed those medicines which he had prepared for the patients himself, and he also died. And when those medicines were investigated, they were very rich, or they were very rich in pesticides. Certain toxic pesticides were there. And he was manufacturing, he was preparing that medicine for the last so many years. But because of some error, he put those medicines in a container which was having the pesticide, because of that. So the quality, that is very, very important. And secondly, avoid multiple prescription of herbomineral drugs. If the practitioner is using some herbomineral drug, it has to be one, not many, because otherwise what will happen, there will be a cumulative bad effect, the chances. So your prescription should be ideally, it should be based on single herbomineral, and I think that has to be judiciously selected, that what kind of herbomineral drug should be prescribed in a particular condition. So that is important. And third point is dose, duration, and the vehicle. This is very important. Now, about the dose, about the duration of the use of herbomineral drugs, very clear recommendations are there in Ayurveda literature. I think Dr. Shashi Kumar will spell out all those things. It is very clearly mentioned that when you use any metallic preparation or any particular bhasma, it is mentioned that how long it can be consumed, and in what would be the total amount of that. So that is very, very important. So whether that amount is consumed in 1 day or in 40 days, so that is also important. So that's a dose, duration, and along with what kind of the vehicle is used, means anupan, which in Ayurveda we call as anupan. So that is also important. Then the long term, when these patients have been put on long-term use of these herbomineral medicines, I think periodic investigations are required, and primarily I think the most important investigations, I think after 40 days or after 2 months of treatment with any herbomineral drug, I think the CBC and the LFT, the KFT, and if there is some other comorbidity, other investigation can be done. But these are because the metabolism of the drugs that happens in the liver, and the excretion is to the kidney. So if anything wrong is being done by the medicine, that will be reflected in the liver function test, and that will be reflected in the kidney function test. So I think after 40 days, after 6 weeks, on an average after 6 weeks, and another precaution we need to take, that is, okay, if the medicine is to be continued for a long time, then give some break, so that the chances of accumulation of that drug, that mineral, or that metallic preparation, that may not happen. The chances may not happen. So give some break, and again you can restart that with a reduced dose. And the general principle in Ayurveda is that there are the first line of treatment in Ayurveda for any particular disease is mainly herbal drugs. Herbal drug. And the second line of treatment is herbomineral drugs. And the third line of treatment is the mineral drugs or the toxic substances like the snake venom or like gold or silver and then this heavy metals. So means in the first instance means these kinds of medicines are not used in the first instance, right? So it is better first to start with the herbal, means the medicines, Ayurvedic medicines, which are made from the plant materials, and those plant materials which are generally regarded as safe, not those which are in the Schedule E1, right? Second is herbomineral, and in the herbomineral, the important point is not more than one medicine or two medicines. So in the herbomineral categories also there are hardly around 46 minerals they are being used in Ayurveda, Siddha, Unani medicines, and out of 46 hardly 10 or 15 are commonly used. And these heavy metals, the processing is very tedious, very lengthy pharmaceutical process, and very few industries they are manufacturing these the formulations made from this heavy metals. So I think there is a misconception also that heavy metals are there in every Ayurvedic medicine. It is not like that. This is also important. Then periodic investigations, which I emphasized, and secondly, interruption of the treatment for some time with herbomineral medicines, and after some time again you can start the thing. Then in case the practitioner gets a adverse report from the patient, I think it should be immediately reported to the pharmacovigilance center which have been set up by the government. I think now we have online system also, ayushraksha.com. No, it is also the case that a report form is there, means how to report that adverse event, and the practitioner can report to that. So this has to be done. So once you report, then it will be documented. After documentation, it will be analyzed by the signal detection committee, and then the causality assessment, and then the regulatory action will be taken. But the chances of this kind of the bad effects of this is more in case of proprietary medicine, not the traditional formulations. The traditional, the classical formulations which are being used by the people for the last so many centuries, they are time tested. Now, another point is, on one hand, the medicines are time tested. They are time tested. They may not be necessarily tested in the laboratory of science, because they are time tested. But those medicines, when they have been tested in the laboratory, they have been found to be safe, and there are many studies. You can see all the scientific literature. There are many studies on classical Ayurvedic formulation, and some of the studies they have been published by Ireland Institute of Medical Sciences, even by the ICMR, and you can see the Ayush Research portal. I think many studies are there. But the problem means the doubt about the integrity of the medicine, about the safety and efficacy of the medicine, that is more towards the new combinations which are in the market, which we call as proprietary medicines. We have taken due care. If you see the drugs and cosmetic rules, we have taken due care that for the proprietary medicine, there must be the proof of safety and proof of effectiveness. We are not saying efficacy like pharmacodynamics or pharmacokinetics. We are saying proof of effectiveness. If you are saying that, okay, your medicine is it is good for kidney disease, or it is good for a liver disorder, so you must submit some proof, and that proof either it should be based on the authoritative books, it could be based on the scientific literature, or it could be based on the clinical trials. So the clinical trials are also coming up. Clinical trials are also coming up in Ayurveda, Siddha, Unani sector. And I think during the COVID-19 outbreak, you might have seen that in the CTRI, I think the maximum clinical trials which are being conducted in the country, they are from Ayurveda, Siddha, Unani. I think more than 60 clinical trials for this COVID-19 related claims, they are being conducted through this Ayurveda, Siddha, Unani medicine. So this is the thing. So clinical trials and the good clinical practices guidelines for conducting of clinical trials in Ayurveda, Siddha, Unani medicine, it is also published. And for the time being, it is not mandatory to follow, but this CTRI registration and the clearance from the IC of a particular hospital, that is, and we have also issued a gadget notification that, okay, if the clinical trial on Ayurveda Siddha Unani medicine is to be done, how it should be done, what are the requirements, those requirements have to be fulfilled after that only. Now, in case the practitioner, our Ayurveda Siddha Unani practitioners, or the practitioners of the other system, if they come across that a patient is having some bad effects, the toxic effects because of the use of Ayurveda Siddha Unani, or the concomitant use of medicines, I think those patients, they deserve to be subjected to Panchakarma therapy, Shodhana, elimination therapy, because in the first instance, immediately those toxins, those heavy metals, or whatever it may be, those can be expelled out. This is, I think this is the wonderful line of treatment in Ayurveda, Panchakarma Shodhana, because the toxins, whether these are exotic toxins or whether they are these are expelled. So this treatment, that is why it is known as Shodhana therapy or the Panchakarma therapy. So, I think these are the aspects which need to be taken care of when we practice Ayurveda. And when we say that the practice of Ayurveda, I think we must take care of three things, 3P: the practice, the practitioner, and the product. All the three are important. The product should be of quality. The practitioner should also be knowledgeable, and he must be aware of that. Okay, what could be the possible bad effects of this drug if it is not judiciously used? And the practice also. Practice means because these days there is a deviation from the standard practice. There is deviation, or there is inclination towards integrative medicine. So when we are moving towards integrative medicines, we also need to take care of what the other practitioners have prescribed to the patient, and what kind of medicines that that patient is taking. Not necessarily that, okay, you also give the full prescription and he's already taking the full prescription from the other side. I think you need to give only that prescription which can bridge the gap, which can narrow down the gaps, not the full prescription. Since I have worked in a hospital, I have seen that the full prescription is given from both the sides. So, and the advisory is very, very important, particularly the lifestyle advisory. I think that is very, very important. I give you one example. Now, if you see the Indian tradition, Ayurveda says that this curd should not be consumed in excess. It should not be consumed in night. But I think hardly there is any home where the curd is not consumed in the night. In every party you find curd, and I think lunch, breakfast, dinner. Now, Ayurveda says that if your physiological channels are clear, you will not suffer from any indisposition. But by using curd, what will happen? Because curd has the tendency to block the channels. So if there is blockage in the channels, micro channels, the transfusion will be impaired, the permeability will be impaired. What will happen? The natural toxins, the natural based products in the body system, they will get accumulated in the body system, and that will lead to some the pathological disturbance. So that will happen, right? So these aspects are very, very important. Means lifestyle very important. I have gone through 2 studies which were from America, that when you get up in the morning, I think that some scientists they study that why the Indians they get up early in the morning. So
What happened? I suppose the sir is missing at present. So by that time, I will ask Dr. Sasi that how do you practice in general and particularly in Rasaushadhi? And what are your criteria of practicing Rasaushadhis? Unmute yourself. Dr. Sasi, unmute yourself.
Okay. First of all, I convey my humble pranams to one and all. And thank you very much for giving me such a chance to interact with you people, the very learned audience. And as far as Ayurveda is concerned, when first of all, what we are doing is we are finding out the basic cause of the diseases by which the particular disease condition is originated. Then we will advise to remove all sort of that causes. So slowly you can see the disease is coming to normal. The patient is coming to normal. The second phase is we are trying to cleanse the body. That is by Panchakarma procedure. We have 60 types of procedures. 5 procedures that we are using oftenly. So it is prominent. That's why the term raised as Panchakarma treatment. With that, if the disease is not coming down, then we will go to drug therapy, herbal therapy mainly. If herbal therapy is found not adequate, then we will switch over to herbomineral therapy, that is called rasa drugs technically in Ayurveda. While administrating the high potent medicine, the profile of administration also will change. Profile of administration will change, not like modern science. We have 10 aspects is to consider to fix the dose. Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vaya, Sattvam, Satyam, Tata, Aharam, Avastacha, Pratakvitha. These are the things that we have to consider when you are administrating a drug. For example, I will tell you a drug called Sahachara. Sahachara means Strobilanthes henianus, a herb. Sahachara Kashayam is very famous one that we are using for rheumatoid. Pardon?
Sashibai, just a minute.
Yes.
Try to conclude and concise within 5 minutes because we are too late.
Okay.
Highlight the important points. Particularly Rasaushadhi point of view.
Yeah. So what I'm telling is our methodology of administration is drug is very different one. So as far as the Sahachara is concerned, when the Sahachara combination we are using in warm season, it will produce Mutrakrasha, that means some urinary complaints. But the same Kashayam to the same patient when we are using in cold climate, it will not produce any more problem. So that's way, that is one factor. So season is a factor, dose is a factor, adjuvants are a factor, and the constitution of the body is a factor. All these things, if you are considering properly, according to Ayurvedic measurement, then that drug will be very safe. So for my students, for purpose, what I'm telling to those people, especially for rasa drugs, classify the raw materials, what you are taking rasa medicines into 5 classes. Depending upon the potency, depending upon the toxic effect, raw materials, toxic effect. Ayurvedic drugs are sometimes maybe giving side effects, but Ayurvedic treatment is not making any side effects. Treatment and drugs are different. When the drugs are utilized logically, it became a treatment. Drug is not always safe, but if the drug is properly administered, that is treatment, Ayurvedic treatment, that is safe. So the first class, now for example, the marine products like Shankha, Shukti, Varadika, all these things, this will not make any problem. If some little bit dose is more, it will not make any problem. Even you just wash it and crush it and powder it, what we call pishti form, you can use it. The second class coming some of the charas, herbal charas and the tankana, kankshi, such charas. So chara means Ayurveda itself cleared that chara pumstopakadina. And if you are continuously using chara, obviously you cannot find out any problem in the body, but in long-stand use, it may produce problem. Chara pumstopakadina. So it's coming in the second class. If it is not cured with first class, you can switch over to second class, or you can make a combination of first and second. Then the third one coming, the metallic preparations. Some minerals also like khasis, that is ferrous sulfate, and abraka, that is a mica. All these things are coming. It's having more potency, but there Ayurveda will go for complicated procedure for purification, marana and incinerations, and amritikarana procedure and dose fixation, adjuvants. We call adjuvants as kramana. Kramana means which will make more bioavailability to the body in a safe manner. Honey is a kramana aushadha, and butter is a kramana aushadha, milk is a kramana aushadha. In our text, it is mentioned this should be given with this adjuvant, this kramana aushadha, as far as the Rasashastra especially is concerned. Okay, then the fourth class is coming, mercury. For the purification of mercury, we will take at least 3 months. Ashtasamskara. Without Ashtasamskara, if you are preparing a mercury, it will make problem. And also, you are using Rasasundara. Rasasundara is very safe if you are using, taking consideration of Ayurvedic advices. But when you are using the Rasasundara for infants, when you are using the Rasasundara for prolonged use, Ayurveda advices go for multiple Belijarana. Belijarana means multiple sublimation procedure. Single Belijarana you can use commonly. But if you are using Rasasundara prolonged, go for at least for Triguna Belijarana. Even Shadguna Belijarana you can go if you are using for infants. In that status, this will not make any problem. So, but I think in the pharmaceutical field, none of the pharmacy in India is marketing different Belijarana of Rasasundara or Siddhamakaradvaja. That should be taken consideration. And at a time, as rightly told by Dr. Kotesha, at a time, you have to stick on one Rasaushadhi only. But not always. When you are treating a cancer patient, you can use multiple drugs therapy. It is inevitable. At that time, dietetic restrictions, what we call Pathyakrama, should be very strict. Then it will be very safe to use. Then that is the other class, the last class coming under arsenics, that like Haritala and Manashila, that means arsenic trioxide, arsenic dioxide, arsenic, I'm sorry, arsenic trisulfide and arsenic disulfide, then copper sulfate, and lead, and litharge, like things. Of course, these things we will use to tackle the acute stage of the disease, but for limited periods. That is my mannerism. In Kerala, we are used like that. When the samprapti of the disease is so acute, for tackling that type of samprapti, we will use this type of class of medicine, copper sulfate preparations, copper preparations. Then if that phase is tackled, slowly we will switch over to herbal therapy. Then at last, rasayana therapy. Then after recovering from a disease, if we are under a prolonged treatment, then we will advise to use Ghrida preparations. And that Ghrida preparation will give very good rasayana effect to the body. And that will nullify most of the side effects produced in the human body. So this is the way how I am practicing Ayurveda in Kerala. So this is very safe. And see, so for toxic drugs are concerned, in herbal toxicity, Valsnabi is the most toxic herbs that we are using in Ayurveda. But we are using after purification, after putting in Gomutra, all these things, after purification, we found that the structure of the alkaloid is changing. It's very safe to use. Also, when you are using Valsanaba, that is in compound form, so that compound may contain the antidotes of some of the Valsanaba, like a Tankan, Maya, Mashika, something like that. Then, as far as the mineral toxic raw material is concerned, arsenics we are using, mercury we are using. But when you are using arsenic, when you are using mercury, Ayurveda advising so many procedures, so many methods of administration for the safety and efficacy. Then as far as the animal products, animal poison is concerned, we are using snake venom even, that not for internally, even subcutaneous of administration of snake poison is indicated in Ayurveda, we called Sujika Pranarasa. In comatose patient, what we can do? We cannot do Vastikrama in that patient. So we have to use such potent medicine. Potent medicine means toxic medicine. But when you are using potent medicine in Ayurvedic way, it is very safe. Even you can safely administrate snake poison subcutaneously for a stroke patient. It's giving wonderful remedy. So that is the way how we are practicing. Anything you?
Yeah, thank you very much, Sachibhai, for your nice narration of your way of practice. Now, Katoch sir has already joined.
Yeah, actually there was some problem. I am also not able to see the screen. Are you able to hear me?
Yeah, sir.
Okay.
I can hear you as well as I can see you also.
Okay, somehow I'm maybe it is a problem at my end. Okay.
Yeah, no, some of the this audience is also saying that they are facing the problem.
Okay, yeah, we'll wind it up now because already too much time.
Yeah.
So Nilesh, you wind up.
Yeah. So any question answer, sir?
There are a lot of questions, but I think it will be difficult to answer.
Some important things, sir.
So I am not able to see the questions. Are you? My Zoom app is partially functional. If there is a burning question, we can take that.
Yeah.
Most people have said that it's a good seminar and integration is an excellent idea. They have praised Nilesh Doshi.
Who is monitoring or maintaining ADR of herbomineral drugs, pharmacovigilance program, ICMR or Indian Pharmacopoeia Commission?
I think Dr. Katoji will have to answer.
No, he has joined. Drug alerts. Sir, how often you have to resort the chelation therapy or dialysis in herbomineral drugs cause nephrotoxicity in your
That is my answer. That I will answer.
Yeah.
So actually we started this program, pharmacovigilance program for Ayurveda, Siddha, Unani and homeopathy drugs in 2017. Before that, in 2008-9, for 3 years, this program was supported by WHO when I was in WHO. So I initiated this program and some centers were very active. But after that, because of a constant support from the government, it did not utilize. But in 2012-13, I was a member of the 12th five-year plan committee. So in that, I could introduce that there must be some safety monitoring mechanism for Ayurveda, Siddha, Unani and homeopathy drugs. And then we conceptualized this scheme. And it was implemented from 2017, October 2017. And today we have a network of around 79 centers in the country. The national center is All India Institute of Ayurveda. And then the intermediate centers for all systems, we have one intermediate center. Like for Ayurveda, we have 2 intermediate centers, one in Jamnagar and another is NIA Jaipur. And the whole of India is divided into 2 parts. So half part of the India is reporting to Jamnagar Institute and the other half is reporting to NIA Jaipur. And for the Siddha system, we have National Institute of Siddha in Chennai. So for Siddha drugs, the adverse reports, they are referred to that intermediate centers at the National Institute of Siddha. For Unani, it is National Institute of Unani Medicine in Bangalore. That is directly under Ministry of Ayush. And for homeopathy, it is National Institute of Homeopathy. So these are the 5 intermediate centers, and below the intermediate centers, which in the allopathic side we call as the regional centers, but here we are calling them intermediate centers. And then under each intermediate centers, we have given 20 peripheral centers. So for Ayurveda, maximum peripheral centers are of for Ayurveda drugs. So around the 50, and the others they are of Ayurveda, Siddha, Unani and homeopathy. So 74 centers are there. And so the mechanism which we have developed is like this, that the adverse, the reports or the adverse effects which are noticed by the practitioners from these centers, they are documented, and then on the daily basis as well as on the monthly basis, they are sent to the intermediate centers. From the intermediate centers, they come to the national center. At the national center, there is a 2 committees are there. One is signal detection committee, and another is that causality assessment committee. Now, the single report, if coming from anywhere, I think that is not important, because unless the good number of adverse reports are coming from the different centers, then you can say that, okay, there is some signal that, okay, this there are some issues with the drug. And then on the recommendation of the causality assessment committee, then the report that comes to the Ministry of Ayush, because the central regulator is Ministry of Ayush. So then we issue instructions to the state authorities that, okay, this drug should be banned, or this should be withdrawn from the market, or other things. So that kind of mechanism has been established in the country in the last 4 years.
So there was the other question of.
So my suggestion to the practitioners is, so whenever they come across that, if any patient is reporting that some adverse effects or some adverse report, this reaction has happened because of consuming any Ayurveda, Siddha, Unani drug, either online, because in ayushsuraksha.com there is a website which is launched by this National Pharmacovigilance Center under the aegis of Ministry of Ayush. Through that website you can get the report. The electronic format is there. In that digital format you can submit the report. So, but that is very important, because we still we are lacking in the culture of reporting. So, culture of reporting of adverse events, that is important. So, whether it is because of standalone use of Ayurveda, Siddha, or it is combined use. So, most of the cases, what I have seen and what have been reported to us, they are mainly when there is mix-up. So many medicines of different systems they are used, and then there are bad effects. I think Dr. Khanna will also agree to this.
Yes.
That because of this multiplicity of the prescriptions, because of that only this is happening.
True.
Yeah, sir. You please answer that.
Yeah, I think the heavy metal toxicity more often is not so severe in terms of drug usage or herbomineral usage or Ayurvedic medication or whatever you say. It's generally more with accidental ingestion or environmental toxicity. Whenever we see a large amount of heavy metal toxicity, we use chelating agents, and most chelating agents used are either BAL or dimercaprol and occasionally EDTA. Now, these the dosage for copper, mercury, arsenic is different. 1.5 milligram per kg, 4 milligram per kg, and so on. Sometimes you may have to use dialysis because of acute kidney injury. And sometimes you may have to use dialysis to remove the chelation, the complexes. So usually dialysis is a very uncommon phenomenon for removal of the heavy metal. It's more for the complexes. And yes, dialysis is required because of the development of acute kidney injury. If the heavy metal toxicity of the drugs is to the extent that there is acute tubular necrosis, then the urine output has dropped significantly. So that is the treatment for heavy metal toxicity.
Sir, I would like to see to it that if you have any questions and queries regarding the herbomineral preparations and its complications, you please ask Katoch sir.
So I am so happy today to hear Katoch sir, because he dealt with it in the entire holistic way, and I really understood. The best thing is the opening statement that हम लोग नदी के दोनों अलग अलग किनारे में. So whatever we are trying to think integrated medicine होता है, ऐसा नहीं है. That live-in relationship का example is very good, and दोनों mix नहीं करना, that was good. The other thing he pointed out is वो जो red bulb हमको दिखते हैं उससे ज़्यादा बहुत सारे green bulbs हैं. I really liked the way he was trying to explain to it. So I have really no questions to ask.
Sir, if you want to highlight some red bulbs from your end.
No, so red bulbs में ऐसा है कि we are going to take case based issues. जैसे डॉक्टर अल्मेडा ने बताया था कि so diabetic drugs use a lot of lead. I don't know how lead probably is a good hypoglycemic agent or whatever reason. And whenever we found lead toxicity, quite a lot of those patients were basically for treatment for diabetes. Then skin lightening creams were the ones which were containing mercury. So they were used for specific purposes, and only in those cases the heavy metal amount or toxicity was found. So, but हम लोग इक्के दुक्के cases देखते हैं. We see just a few occasional ones, and I'm sure thousands of people must have used those skin lightening creams, and maybe will having a good result. So I will obviously want to communicate with Dr. Katoch much more often than what I have done. This is just one of dostiya relationship that has developed.
Dr. Khanna, I think the important point is, एक तो क्या है कि I think the most of the damage has been done by this internet sale of drugs.
True. I pointed that out, that there are net के sales.
Net के sales. अच्छा उसमें होता क्या है कि जैसे आप मान लो जो कंपनीज हैं उन्होंने तो अपना प्रोडक्ट बेचना है, अब उसमें जो इतना बढ़ा चढ़ा के लिखते हैं वो कंज्यूमर क्या करता कि अपने आप खरीद के खाना शुरू कर देता है। अभी जैसे आपने बताया कि हैवी मेटल की टॉक्सिसिटी वाले जो केसेस हैं वो कम हैं, परंतु हैं, उसका भी कारण क्या है? उसका कारण क्या है कि वो इंटरनेट में देखते हैं और कहते हैं अच्छा बसंत कुसुमा का रस। No, the practitioner knows that the Basant Kusmakar Ras is not meant for hypoglycemic effect. It is for the diabetic neuropathy. It is for the treatment of diabetic neuropathy. It does not have hypoglycemic effect. ठीक है, तो ये चीजें जो है जब तक पता नहीं होगी तो क्या कहते हैं होगा।
ये सब कच्चे लोग हैं, थोड़ा बहुत इधर उधर से सीख के पढ़ के. So of course we are also facing that problem of Google doctors. Google doctors are a big problem for us. They just read from Google and start treatment and then land up with all the problems. The same Google doctors Ayurveda का कुछ पढ़ लेते हैं and then they go to any shop and buy it or
But the most of the problem is mainly because of this self-medication.
Self-medication. वही Google doctors वहीं से पढ़ के they start treating themselves.
And secondly, they do not reveal that what kind of medicines they are taking from the other doctors. They never repeat.
Correct.
So should we display that slide, what we have thought of the guidelines, what I have written to you for the uses of herbomineral drugs, what I have said with you yesterday.
So I think you will have to give it to everybody, because now there are very few people remaining because of the delay in time. But आपको every person सबको देना चाहिए.
Yeah, that we will give it to all. But still, as it's a
it's a very
session,
nice one.
I suppose.
Yes, you can display it.
एक जो बड़ी इंपॉर्टेंट चीज है जो मैंने कहा कि वो जो नदी है, जो नॉलेज की जो नदी है वो बह रही है, हम एक किनारे पे खड़े हैं, वो दूसरे किनारे पे खड़े हैं, उसके साथ साथ ये भी है कि जो अप्रोच है, द अप्रोच ऑफ आवर सिस्टम इज हेल्थ सेंट्रिक,
होलिस्टिक,
नहीं हेल्थ सेंट्रिक, और जो उधर जो अप्रोच है दैट इज मेडिकल सेंट्रिक,
डिजीज सेंट्रिक.
यस, अब क्या है कि वन इज मेडिकल केयर, अनदर इज हेल्थ केयर.
यस, करेक्ट, यू आर राइट.
So, sir, what we would like to say to the audience is a take-home message is that manufacturing of the drugs should be standard. This should be the message to the industry. Doctors, the baseline investigation should be done before starting any herbomineral or any treatment. As we see that even if you give herbal or herbomineral preparations, from medical legal point of view also, I have understood after seeing today's session that if at all already the patient's creatinine level is high, and if you have given these drugs and let it be on the same level, 2.5 to 2.5 only, but if it was not known prior, then the person may tell you that after taking your medication I have developed CKD. So even from that point of view, documentation from the medical legal point of view, I suppose it's very necessary to have a baseline investigation like serum creatinine, eGFR, SGOT, SGPT. Repeat it after 2 to 3 weeks, and or as when you switch over to herbal or panchkarma therapy, for long-term uses, because many a times we used to give it for 6 months or a year or so. At that time, afterwards, take a regular readings of prescribed investigations after every 2 months. Avoid using multiple herbomineral drugs at a time. Measure mercury, lead, etc. level at a regular interval. So if at all it has started, we can pick it up early, we can treat it, and we can prevent the further damage. Purchase standard medicine of a standard companies, and at the same time, we request the regulatory authority to take a awareness program for both industry and practitioners at a regular interval, so we can avoid such type of the problems. And with this one last slide, that तदेव युक्तम भैषज्यम यद आरोग्यम कल्पते सचैव भैषजाम श्रेष्ठो रोगेभ्यः यह प्रमोचयेत्. वहाँ औषध युक्त वही औषध युक्त है जिसका प्रयोग करने पर आरोग्य की प्राप्ति हो सके, और वही व्यक्ति वैद्यों में श्रेष्ठ है जो रोगियों को रोग से मुक्त कर सके. मतलब औषध और वैद्य दोनों रोगियों के रोग को मुक्त कर सके, ऐसे जब रहे तभी वो श्रेष्ठ है, बाकी सब गड़बड़ है.
Dr. Doshi, can I make a last statement?
Sure, sir. Yeah, sir.
Sir, ऐसा है, more is unknown than the known. More is unknown than the known. अब ये जो known है, उसके बारे में जो है एक इंग्लिश फिलोसफर है, उसने कहा है, to know that you know what you know, and to know that you do not know what you do not know, that is true knowledge.
True knowledge.
हम क्या करते हैं, जो हमें पता नहीं है, हम उसके ऊपर क्लेम करते हैं. ये एक बहुत बड़ी बात है कि हमें मालूम होना चाहिए कि what we are prescribing and what others have prescribed. तो ये एक बहुत इम्पोर्टेंट बात है. और दूसरी एक चीज ये है कि मैं अपने सो कॉल्ड एलोपैथिक फ्रेंड्स जो है उनको कहना चाहता हूँ. मैं तो ये कहता हूँ, मैं नहीं कहता एलोपैथी. देखिए, आप एलोपैथी की बुक्स आप पढ़ लीजिए, कहीं पे एलोपैथी शब्द नहीं है. मेडिसिन इज मेडिसिन.
करेक्ट.
ठीक है. और मेडिसिन की जो हिस्ट्री है, अगर देखा जाए, जो ग्लोबल जो हिस्ट्री है, इट स्टार्टेड फ्रॉम हिपोक्रेटिस जो है. वो आयुर्वेदा को छोड़ दीजिए आप. हाँ. और वो जो हिपोक्रेटिस है, हिपोक्रेटिस को जो है, हिपोक्रेटिस इज फादर ऑफ द यूनानी मेडिसिन एंड हिपोक्रेटिस इज द फादर ऑफ द मॉडर्न मेडिसिन. ठीक है. अब वो कैसे बाइफर्केशन हुई कोई नहीं जान पाया आज तक. तो कहने का मतलब पहले मेडिसिन ही थी, और वो जो मेडिसिन थी दैट वाज नेटिव मेडिसिन. अब वो नेटिव मेडिसिन जो थी, उसका हुआ क्या कि वो जो है उसकी जब डेवलपमेंट हुई तो एक बन गई सेंट्रल एशियन मेडिसिन. ठीक है. वो ईस्टर्न मेडिसिन. तो ईस्टर्न मेडिसिन जो है दैट कल्मिनेटेड इन द फॉर्म ऑफ ट्रेडिशनल चाइनीज मेडिसिन,
चाइनीज एंड टिबेटन.
हाँ. और जो साउथ एशियन जो मेडिसिन थी, जो ट्रेडिशनल मेडिसिन थी, ट्रेडिशनल मेडिसिन जो है वो भी शब्द कभी यूज नहीं हुआ है. ये जो है, दिस वर्ड हैज बीन कॉइन्ड बाय WHO. ट्रेडिशनल मेडिसिन, ट्रेडिशनल कुछ चीज नहीं है. अगर आप ये देखा जाए तो आज जो मॉडर्न मेडिसिन है, मॉडर्न मेडिसिन हैज बिकम ट्रेडिशनल. आप देखिए स्टीरियोटाइप प्रिस्क्रिप्शन वो ट्रेडिशन है.
yes.
ठीक है. और वेयर एज द ट्रेडिशनल मेडिसिन सो कॉल्ड, अब उसमें क्या है, मोर एंड मोर साइंटिफिक इनपुट्स आर गोइंग, सो दैट हैज बिकम मॉडर्न. ठीक है ना. तो ये जो चीज है. और उसके बाद क्या हुआ कि ये जो दो सिस्टम्स थे, एक चाइनीज मेडिसिन और एक इधर आयुर्वेदा, सिद्धा, यूनानी, ये हो गया. अब देखिए, इंडिया इज द वर्ल्ड लीडर इन ट्रेडिशनल मेडिसिन इन टर्म्स ऑफ आयुर्वेदा, इन टर्म्स ऑफ यूनानी मेडिसिन. अब यूनानी मेडिसिन जो है, इट हैज कम फ्रॉम ग्रीस. ग्रीस में आज एक भी इंस्टीट्यूट नहीं है. हमारे यहाँ पे जो है 60 आयुर्वेद यूनानी कॉलेजेस हैं, यूनानी की रिसर्च काउंसिल है, नेशनल इंस्टीट्यूट है. ऐसे ही होम्योपैथी जो है, इट केम इन 1920s फ्रॉम जर्मनी. हाँ. And the first practitioner of homeopathy who came from Germany, he treated Maharaja Ranjit Singh. But now today, India is the world leader in homeopathy. We have around 200 homeopathy colleges, homeopathy research council, National Institute of Homeopathy. ठीक है. And more papers are published from India than from anywhere else. तो कहने का भी है, तो मेडिसिन जो है, मेडिसिन इज मेडिसिन. उसको जो है कोई नाम मत दो आप. मैं ये कहता, हाँ, अप्रोचेस जो है डिफरेंट हो सकती हैं, पर वो जो अप्रोचेस है दैट वी नीड टू अंडरस्टैंड. और उसमें क्या है कि वो सिटिंग टुगेदर एंड लिविंग टुगेदर, दैट इज इंपॉर्टेंट. द इंटीग्रेटिव थिंकिंग इज रिक्वायर्ड टू प्रैक्टिस इंटीग्रेटिव मेडिसिन.
सर आज के सेशन के बाद में एक चीज हम जरूर कह सकते हैं और गौरव के साथ में कह सकते हैं कि हम दोनों के लिए, सर के लिए और मेरे लिए, दोनों के लिए ये सेशन कैसे कंडक्ट करना पूरा कोर्स में was really a big question mark.
Challenge.
And a
It
challenge.
was a challenge.
And it is the history that we could have done this in such a harmonic way that it sets an example that many more such sessions.
हम लोग दोनों डर रहे थे.
Yes sir, of course.
हम लोग दोनों डर रहे थे.
दोनों डर रहे थे और वो डर.
कटोच जी, we were scared कि कैसा जाए.
हाँ, मुझे मालूम है कि दोनों तरफ से मिसाइल्स जो है प्यार रखी थी, चाहे बस बटन दबाना था. मिसाइल्स जो है वो दोनों तरफ से प्यार थी, पर हुआ नहीं.
नहीं ऐसा
चलो ठीक है. We are happy at the end result.
Outcome is good.
Yeah, we
Outcome
have
is good.
been able to do
So,
it in a nice
if you
manner,
see the comments, the comment section, everybody is extremely happy कि ऐसा हुआ. We were able to pull it off.
इसमें डॉक्टर दोषी एक चीज है, ये अभी जैसे डॉक्टर खन्ना जी की जो प्रेजेंटेशन थी, डॉक्टर आलम की जो प्रेजेंटेशन थी, उसमें जो प्लांट्स जो बताए गए हैं, आप उनको ये देखिए कि कौन कौन से इंडियन प्लांट्स हैं, विच आर
इंडियन कौन से, ज्यादा चाइनीज हैं,
ज्यादा चाइनीज हैं.
हाँ, ज्यादा चाइनीज.
अब देखिए,
और ये जो आर्टिकल्स भी यूएस के हैं, तो उन्होंने वहाँ चाइनीज और टिबेटन मेडिसिन ज्यादा है.
और दूसरी,
यू आर राइट, इंडिया में उतने नहीं है.
दूसरी बात है, उन्होंने क्या है कि उसके डेरिवेटिव्स या आइसोलेट्स या फाइटोकंस्टिट्यूएंट्स यूज किए हैं, नॉट इन द होलसम फॉर्म, नॉट इन द होलसम फॉर्म. एक चीज जो है ये बहुत ज्यादा इंपॉर्टेंट है कि जो इंडियन जो मेडिसिन प्लांट्स हैं, देखिए एक चीज जो है, पूरे 3 घंटे की डिस्कशन हो गई है, हमारे आयुर्वेदा में जो है देयर आर सर्टेन नेफ्रोप्रोटेक्टिव प्लांट्स, उसका जिक्र नहीं हुआ. और 2 प्लांट्स है, मैं वो आपको बताना चाहता हूँ. वन इज गुडुची टीनोस्पोरा कॉर्डिफोलिया एंड सेकंड इज पुनर्नवा, बोरेविया डिफ्यूजा. इसके ऊपर जो है कोई डिस्कशन नहीं हुई. बट इफ यू सी द साइंटिफिक लिटरेचर, आई थिंक लॉट ऑफ good work has been done on these 2 medicinal plants, particularly with regard to this kidney disease. My mother,
Dr. Katoch, my teacher, Dr. Vidya Acharya, she is no more. She used to use these drugs for medicines, which when patient was not responding to allopathic medicine, she was using these 2 drugs. So you are right.
So these can be advocated as adjuvant use to bridge that gap. Because
मैं आपको एक कमेंट सुना रहा हूँ, उसमें लिखा है, we need more lectures from Dr. Katoch sir. That is in the comment section.
Okay. I can say one more thing, sir. Dr. Saridini Dhanuka, Dr. Ravi Bapat, Dr. Sanjay Yok, and Dr. Valai Nathan. उसके बाद में हमको जो 2 और इंटीग्रेटिव मेडिसिन को प्रोपेगेट करने के लिए और सपोर्ट करने के लिए जो 2 और कोई लोग आए हैं, तो शायद वो आज डॉक्टर उमेश खन्ना और डॉक्टर एलन अलमेड़ा है. I must thank and congratulate him.
I think बहुत टाइम हो गया है. I think
I will ask Dr. Kavita to conclude the session. Just let it be, but let this formality get over by within 1 minute. Dr. Kavita, please.
Yes, sir. Good evening, everyone. It's my privilege to propose a vote of thanks speech today. I, Mrs. Dr. Kavita Vishwakarma, on behalf of Association of Ayurvedic Practitioners, Mumbai Kidney Foundation, and Parul University, all the delegate participants and the entire organizing team, let me call it fraternity of nephrology today here. And on my own behalf, extend a very hearty vote of thanks to all the speakers, Almighty God, Dr. Katoch DC sir, Umesh Khanna sir, Dr. Nilesh Doshi sir, Dr. Shashi Kumar sir, Dr. Alan Almeida sir, Dr. Raja Ramchandran sir, gracing today's event with your very important work and sharing with us your findings, opinions today, thus enlightening us. So finally, I thank all the participants for being there with us so long, and our entire organizing team for the efforts in management. Thank you very much. Have a great day ahead.
Thank you.
Thank you, Kavita. Thank you, Dr. Khanna, and thank you, Dr. Doshi. No, I can leave. I think.
नमस्कार सर, अरे
नमस्कार।
आप आए समय निकाल के इतना बिजी टाइम में से हमारे लिए और इतना अच्छा टाइम निकाला. Really we are very much
Unfortunately, बीच में जो है थोड़ा सा नेटवर्क प्रॉब्लम हो गया, so I missed about 7-8 minutes. चलिए कोई बात.
Thank you so much. बहुत बढ़िया हुआ.
Okay, thank you.
Thank you.
Thank you.
Okay, all right. Thank you everybody.
Yeah.
Thank you.
दिलीप भाई कुछ कहना है, राजीव भाई कुछ कहना है आपको?
अभी 3.5 घंटे हो गए हैं, सबको अपने अपने घर जाने दो.
नहीं, सबको अपने अपने क्लिनिक जाने दो, घर कहाँ जाएंगे?
घर तो बैठे हैं.
घर में तो बैठ के सुन रहे हैं.
घर सुन रहे हैं.
सर ये तो हम being an Ayurvedic practitioner, first I would like to thank both of you, the modern practitioner, but the more thanks to Dr. Katoch.
Yes.
Reason behind it is that he has narrated the things accordingly.
Yes.
And the things which are supposed to be believed.
Yeah.
Even among the Ayurvedic practitioners, they believe that mercury should not be used, Basant Kusmagar should not be used, like that. In the past also the questions were there.
Yeah.
But also being an Ayurvedic practitioner, even I have experienced in my practice that we use at certain amount of mercury in the certain diseases, and the patients are getting benefit of it. But I think both of you have said that we must have regular or interval. At a regular interval, we must have the investigation criteria, so that the patient can be saved, and the drugs what we are using from the Ayurvedic pharmaceutical companies, then those also can be trusted or not to be trusted, both the ways.
True.
Thank you very much, sir.
Thank you
very much on behalf of me being the president of this Ayurvedic Association practitioner. Yeah, thank you.
Actually, I forgot to narrate one sentence that the basic motto of the course is to save the kidney.
Correct.
And the organs. And by whichever means it damages the organs or lives should be prevented. And correct. This has been very well communicated in a very excellent way. You see, this can be presented in a different way also. By presenting the cases that this case has become worse because of this, that. Instead of having that blame game, the things have been presented in such a way that it has been conveyed, communicated, and convinced. 3C, I suppose, is a very important thing.
Sure. Good. Thank
you.
Yeah. Okay.
Bye.
We meet again. Bye.
Yeah, Pallavi, you can close the session.
Okay, sir. Congratulations, sir. Wonderful.
बहुत टेंशन वाला काम था आज का सेशन का.
नहीं सर, बहुत अच्छा हुआ. हाँ, बहुत अच्छा हुआ. सुपर. Congratulations to you.
और हमको डर था, इसके लिए हमने शायद let me tell you honestly कि अगर बराबर नहीं गया तो क्या होगा.
नहीं, कटोच was very
कल रात की नींद मेरी हराम हो गई थी.